Hello, everyone. Good afternoon. Welcome back to the Manila Bulletin Sustainability Focus Session. I'm Aziza Mondañedo, your host this afternoon, taking over for my wonderful co-host who was here, Jackie Go, this morning. How are you guys? Good, great. Can I get a show of hands? Who was here this morning for the morning session? Was anyone here? Okay, we have a few over here and there at the back. Also, I want to ask everyone, and don't be afraid, don't be shy to shout. What courses are here? What students from what courses are here this afternoon? Nursing! Okay, we love nursing. What else? Physical therapy. Okay, sorry, hindi ko narinig. What else? What about nutrition? Do we have anyone from nutrition? Wow, wonderful. MedTech, anyone from MedTech here? What about tourism? Anyone from tourism? Ayun, okay, wonderful. I love the energy. So parang you guys had a good lunch, no? I think you had a good lunch, and I love the energy in the room, and I'm very glad that all of you are so enthusiastic because this afternoon, we are gonna continue hearing from more notable companies and experts, and they are gonna talk about their sustainability efforts and how it will be applicable to what you're learning in all of your courses. But before we continue this wonderful educational day, I would like to please remind everyone to scan the QR codes. Have you guys scanned your QR codes already? Not yet. Okay. They are, if you look around the room, they are here to your left, to your right, behind you. Please make sure to scan those QR codes and answer the very short survey because this will serve as your ticket for this afternoon's raffle. Okay, we're going to be giving away some really cute, exciting prizes courtesy of our featured brand partners in today's session. So let me give you a few seconds. If you haven't done it already, there are QR codes over here at the back. And here on the other side, they are all over this auditorium. Take a moment to scan that now and make sure to answer the survey, okay? I'll give you 10 seconds. 10, parang you're finished na eh. Okay, wonderful, never mind. So guys, what do you say? Let's continue. Can I get a yes? Yes. No, it has to be as loud as the nutrition students. Can I get a yes? Wow, okay, perfect, wonderful. Without further ado, let's welcome our keynote speaker for this afternoon. She earned a master's degree in food security and nutrition from the University of Edinburgh in Scotland. She is also the founder and editor of Mesa ni Misis. You must have heard of it, an online platform for plant-based recipes and healthy living. Tatler Asia also recognized her in 2021 as one of Asia's most influential for her groundbreaking advocacy and initiatives in promoting healthy eating. So, ladies and gentlemen, everyone in the room, let us all get together and be ready to welcome on stage here to discuss sustainable eating. A round of applause, please, for Miss Juana Manahan, Yupangco.
Okay. Good afternoon. I like the nutrition student over there. I said, woohoo! Said so excited to hear mga kakapwa nutrition. Okay, I'm not sure if I'm gonna walk around. So I was watching the videos of the students who were speaking today, and I heard a lot of excellent answers about what is sustainable nutrition. And the thing that resonated with me was the concern for everyone about those who can't afford healthcare. Diba nga, mahal magkasakit nowadays. And I think you're all here because we know that. It's expensive to get sick, and we want to be part of that. It's either a system that goes with it, with health, with nutrition. It's one entire thing. So Mesa ni Misis, as I don't know if you've heard of it, but we're an online platform, and really it's a movement. Sorry, this is not, where do I point this thing? There we go. So the main goal, the main focus of Mesa ni Misis is using local food, yung mga bahay kubo vegetables, to nourish our bodies because of all their natural medicinal properties. I came up with this when I was pregnant and feeding my 2 kids. I thought, ang mahal naman ng mga gamot, all this fenugreek, all this stuff from abroad. What about the people who can't afford it? In fact, when my cesarean section wouldn't close, my yaya of 40 years told me that I should use yung dahon ng bayabas. Have you heard of that? You boil it and then you take a bath with it. My doctor said, don't do that, it's gonna get infected. But after 1 month of it not closing, I said, you know what, it's not gonna hurt, I'll just try it. And then it closed in 2 days, and I went back to the doctor. I said, see, that's the dahon ng bayabas that my helper brought in for me. So there is power in our local fruits, vegetables. We use this to heal us. Food is our healer. Oops, sorry, where am I pointing this? Okay, here, right? So I've created programs over the last 7 years, collaborating with different restaurants, different institutions. I saw that Medical City was here. Right before pandemic, I created their plant-based menu for them. So I'm sorry to miss them. But we created their plant-based menu for them, and they launched it right before pandemic. Another partner, former partner of mine, is Maxicare, who supported both my books. Their chairman is plant-based, and now we're working. We've always worked together to push this agenda of plant and planetary-based nutrition. So thank you, Maxicare, for all our collaborations in the past. Oops. Okay, so health doesn't start here at your school. Health really starts at home with our moms, our dads, our caregivers. But the truth is, most of the people who provide food and who provide our primary source of nutrition don't know anything about nutrition. I'm sure any one of our nutrition students can recite to me the PDRI. Kaya nyo ba? Let's go. How many percent for protein? I'm not hearing it. Vitamin A, daily recommendations. Hindi niyo pa nako-cover? Okay, meron na. Okay, so that knowledge is not available to our moms. My mom wouldn't know that. Your mom doesn't know that. If they packed your baon today, they don't know that, right? But they're the ones who are responsible for nourishing our families. So that is my focus. That's why we're called Mesa ni Misis, is to teach the moms, the caregivers about nutrition without scaring them with all the tables and things like that. So this is a picture of me with a giant kalan in Ormoc City, where we cooked for 200 athletes. These women are the barangay nutrition scholars who I trained. We taught them very simple things about basic cooking. I was actually shocked. And you had a student here who spoke about people in the periphery. I kept hearing that, who don't understand or who don't have access. I was really shocked when I got there, when I was measuring the food. Parang yung 1 cup nila, iba-ibang size yung 1 cup. And I realized they were using any cup, teacup, mug. They didn't realize that their 1 cup had a standard measure. So very simple things like that you and I take for granted, hindi po nila alam yan. So even that, it was hard to roll out a plan for them. We really had to start from zero. Even buying shrimp or fish for the meals, they never took account the shrinkage, so kulang-kulang. And they are moms, they provide food for athletes every day at hindi nila alam. That's why we do what we do. So I think our nutrition students might know this, but most Filipino adults take in too much fat, too much protein, too much salt, and everybody smokes too much, or now I guess vapes too much. And this is, we don't take enough fruits and vegetables. We only take 30 to 40%. sorry, 30 to 40% of our recommended nutrient intake. It's really, well, I think we'll see it in the next slide, what our plates look like. But children are also obese. It's called the double burden of malnutrition. How is it possible that they're overweight but also malnourished? It is entirely possible. When I see it in the barangays, the moms who bring their kids who are eating cupcake and Dutch milk. By the way, that's not real milk. It's sugar and like strawberries. But that's what they're eating. When I'm giving my seminars at like 8 in the morning, that's what these people are feeding their kids. So they are too big, but not nourished properly. This is what our plates look like across the board for all age groups. So what's the common denominator? It's rice. Now, there's nothing wrong with rice in itself. Rice, actually, I would rather that people ate rice instead of skyflakes, because rice actually has protein. It's not fried in lard. I would actually rather that. The problem is they're not putting much else with it. There's milk there for kids. It's not breast milk. It's powdered milk, which, as we know, is full of sugar. And of course, pork. So pork is the #1 most consumed meat in the Philippines. In fact, we eat so much pork, we have to import the pork because we only produce 50% of it. That's how much we love our pork. I recently published a paper about replacing pork with orphan legumes. So ano ba yung orphan legumes? Things like kajos, sitaw, paayap, yung mga beans that we have locally. The only bean I think that everyone knows is mongo, right? So there's so many other beans that are native to the Philippines that can replace the nutritional value of pork. But that's crazy. This is from the National Nutrition Survey of 2018. So no surprise, our children, young kids, are eating the same things. This is because of modeling. I don't know if anybody are parents here yet, but what we eat as adults, the children see. So you guys, your students, what you eat will reflect when you have your patients, your nieces, your nephews. They are watching us, and they eat all of this stuff. Modeling behavior actually is more effective than forcing or threatening a kid to eat properly. If they see mom, dad, tito, tita eating healthily, they'll want to do it too. So that's my, okay, do we know this? They're not your sponsor naman today, no? Okay, no. Good. They might kill me. So there's a lot of mixed research, I suppose, about this. There's a lot of stuff. Si Liza Soberano na nga, nandun na siya sa Ajinomoto, di ba? Siya na yung model nila because daw there is no proof that it's really bad for you. So I also read up on that. Yes, little amounts are okay. There's a magazine, I think it might have been Society magazine, that actually came out with an article about MSG is not bad for you in small doses. Fine. But if you are eating it every day in your food, what happens? MSG is an excitotoxin. An excitotoxin elevates the taste of everything. What happens? Nasasanay ka sa ganun na lasa. So, if you're eating your mom's nilaga na walang magic syrup, you're gonna find it plain, you're gonna find it boring. You're gonna go out, look for fast food to satisfy your taste bud. And that stuff, that's when it gets tricky. That's when it becomes unhealthy. So, that might be what is actually bad for you, the addictive property of it. So challenges to food security and health. Again, in your videos earlier, I heard lack of distribution platforms. In Manila, we actually lose about 70% of the produce that comes from Benguet because of improper packing, transport delays, and making patong on the way. So by the time stuff gets here, people say, ang mahal-mahal ng gulay. Yes, because ang dami ng layers to that. But at the farm gate, it's actually a very fair price. it impacts climate change as well. The way it is now, look, it looks like it's dark outside, but it was so hot earlier today. We cannot predict the cycles of our harvesting anymore. It's very, very difficult. Things are small. Like I was buying tomatoes the other day, ang liit-liit, maasim. We can't count on our produce the way we used to anymore. And last but not least, food preferences. And that's because we allow magic syrup into our home. We're going out looking for this taste that is magic. So another part of food security and sustainable nutrition is the impact to our planet. So here you'll see the different colors. This is from a study that shows how much we have to change to get to sustainable eating patterns. So there, the red one, it's greater than 230 points by ways of this study, that we're the same as the US. But that's not surprising because our eating habits are just like the US. Lots of processed food, lots of packaged food. So it's us, US, all those places that are red have a long way to go in terms of being more sustainable in the way we eat. So these are the main components that people look at when you're talking about a sustainable diet. There's carbon footprint, where the food is sourced. So your broccoli that comes from Australia that goes into a stands or marketplace, they sell it for 800 pesos. The carbon footprint of that is so high compared to the kangkong that comes from down the road, or the kangkong you're growing in your backyard. Blue water footprint, how much clean water is used in agriculture. So the reason that the Philippines is so very high on the unsustainable eating is because of our rice consumption. Rice produces a lot of carbon dioxide and takes up a lot of water. Kawawa naman yung rice, but that is a fact of how rice is grown. Locally sourced food has less of a carbon footprint as it travels not so far away. Some crops such as legumes, which I love beans, they actually cycle the nitrogen in the soil. So if we start planting more beans and eating more locally, this might help our sustainability footprint. Now these are our favorite animals to eat, right? However, because of big farm production, because we need to eat so much, chickens are now raised in 21 days. Guys, remember this, the nutritionist, chicken's probably the dirtiest animal you can eat because they put all the antibiotics, all the hormones, it's all in the feed. When I first started years ago, I was still saying they inject it. They don't inject it anymore. It's already in the food. So be careful where you source your chicken. You should wonder why it's so fat and so cheap in the grocery. You need to question that. Beef, I think this statistic for beef being so full of antibiotics is not as bad here in the Philippines as it is in the States because we don't eat that much beef here. What we eat a lot of is pork. So determined by WHO to cause colorectal cancer has already been proven. And we import so much of this stuff. Even fish, my gosh, ano nakakainin natin? Even fish is not that safe, farmed fish. So I personally stay away from bangus and dory because I've been to like these farms, they're fed very, very dirty things. So be careful what you eat and where you're sourcing it from. Instead of eating these things that come from farms, opt for our local fish. Did you know that I think it's yellowfin tuna is actually MSC certified sustainable in the Philippines? So we have tuna that is sustainable that comes from off the coast of Mindoro. Sardines, flying fish, all these things are local and are brought in by our fishermen. So look for those things. Kung nasa palengke kayo, if you're in the supermarket, Don't go for the prepackaged stuff. Go to the fishmongers. Choose those because those are most likely line-caught fish. And how many gallons of water go into processing a pound of food? So beef is the most, chicken is the next. Compared to our kamote, eggplant, and pechay, use much, much less water. So going back to the blue water use. I think it's reaching. Oops, sorry. Am I going back? Is this right? Okay. Okay, there. Yeah, it's scary. That's a bit of plastic that's found in a fish caught off Manila Bay. Ugh. So maybe let's think about where we're getting our fish. I mean, if you look at Manila Bay, you don't want to eat something from there, diba? So let's think about where we're sourcing our food. Enter the Eat Lancet Planetary Health Diet. Have you guys heard of this in nutrition? Are they teaching you this? They should be teaching you this. This is one of the newer developments in nutrition. And this is a plant-forward diet. And I say plant-forward because the animal that you eat is very little, and it's now replaced by plant proteins. So that came out in 2019. I'm not sure if you can see this, but the bulk of the calories come from grains and fruits and vegetables and legumes, and very, very little from animals. So they developed this because they realized they cannot push everybody to be vegan. Masisiraan sila ng ulo if they do that. It's just about reducing your intake of animal protein and increasing your intake of fruits, vegetables, and legumes, just diversifying your diet. Focus of the planetary health diet is all these things: carbon footprint, water use, climate-proof agriculture. That means eating things like kamote, like beans, so that when it's raining, when it's flooding, you're not so worried about the price of rice or onions going up. There's something staple that will keep you full and healthy. Increasing your plant-based protein, and of course, taking into account health and nutrition. So I'm actually in the middle of localizing that for the Philippine context. So maybe next year, Manila Bulletin will invite me and I can present that to them. It combats non-communicable diseases. So I've been running programs using the planetary health diet adapted to the Filipino context in different places. My latest project is in Ormoc, and we saw drastic reductions in blood glucose and cholesterol from putting people on this diet. And that just really comes down to not eating processed food and eating animal-sourced protein just once a day can make such a difference to your blood work, to your diet. So this is just some photos of me sourcing stuff locally, because a big part of localizing the planetary health diet is going to the markets. After all, my background is cooking. It is being a mom. It is shopping. So I love to go to local markets to see what's there. That's the only way I can teach people what to cook and what to do with their local produce. This is the anchor of what I do. I go around, I'm not going to make you sing it today, but we teach the Bahay Kubo Kitchen. I don't know, tinuturo ba sa inyo ito about our local stuff? They're teaching you naman. Okay, very good. I'd hate for them to be teaching you all about broccoli when we have singkamas that are actually good for heart disease. It's a prebiotic. It is good for digestion. Talong, antioxidants, anthocyanins. Do we know what that is? It's purple. It's an antioxidant. So eating things that are purple, red, orange, the more colorful, the more antioxidants you have in it. It's very good for blood sugar also, yung talong. Proteins. We find proteins in the Bahay Kubo song with all of these beans and nuts. I have a question. Do they still teach you that beans cause uric acid? I'm curious. Totoo ba? Why are we sound unsure? Does it cause uric acid, beans and nuts? No. Okay, we need to tell more people that. You would not believe how many professionals, how many grown adults actually still believe that. They say, hindi ako kumakain ng munggo kasi nakakataas ng uric. Sir, hindi. Yung beer na iniinom nyo, yung milk tea na iniinom nyo, yung chicharon, yan ang cause ng uric acid. Hindi po ang munggo. So, let's spread that to everybody. I love it. This new generation will correct that old mindset that people have. Ito, kundol. Alam ba natin anong kundol? Winter melon tea. Yan, alam niyo yan. Yan yung kundol. So kundol or winter melon is actually really expensive in Chinese restaurants because it's good for body detox. It regulates your temperature. They love feeding it to women who have just given birth to regulate temperature and detox the blood after giving birth. I really like this. It's a remedy to food poisoning. Not sure how it does that, but it's supposed to do that. Patola, ito, known as loofah in English. It's good for diabetes, arthritis, healthy skin. It actually has a lot of iron, which is why it's used to combat anemia. Upo, ito, favorite ko to, mura lang to. We actually turned this into a lasagna. It's good for anti-aging, reduces liver inflammation, good for digestion and high blood pressure because of all the water and all the fiber that's in it. Kalabasa, this is probably the easiest thing to feed young kids. So your patients who are children. I remember my kids, the first food that they ate was kalabasa when they transferred to solids. Anti-diabetes, anti-inflammatory, so many good things, and so cheap. Fun fact, we call this kabocha squash. Yan yung kalabasa natin. It's actually a Japanese variant that we plant a lot here. Ito, labanos, very good for red blood cells, heart health, and metabolism. Mustasa. Did you know that mustasa is a cruciferous vegetable? Because when you flip it over, I see the nutritionist nodding. When you flip it over, it forms an X at the bottom. That's just like broccoli. So this is the long-lost, very thin cousin of broccoli. If anyone asks you if there's any substitute for broccoli, well, this is its cousin. Very, very good for vitamin K, very good for lowering cholesterol. So before you prescribe your statins and your medicines, maybe prescribe them mustasa. All of this, ito yung mga panggisa that goes into magic syrup. What magic syrup tries to imitate. This is what it does. What it cannot imitate are the antioxidants and the anti-inflammatory properties that this stuff has. Ito po yung base natin sa lahat. So don't skip this part. In fact, this might be the most important part of your food. So as I wrap up, the principles of a planetary diet: more fruits and vegetables, whole grains, beans, a little bit of egg, unprocessed food. That is the most important thing about following a planetary diet. So it addresses food security, all of these things, obesity. See, and in the NCR, there's 12.5% that are obese, which is a huge percentage. Access to healthy food is limited by availability and price if you're only buying imported things. On my way here, I saw so many markets on the side of the road with all these things. That's all you need to eat. It's around us, it's everywhere, and it's very cheap. This is a food pyramid that I saw when I was working in a school in Baseco. It's very sad to see. I was very sad to see it. Bakit po ganyan? A food pyramid is supposed to be localized, right? It's supposed to show us what's there. This is what's there. This is what they see. They see water in plastic bottles. Their carbohydrates are instant noodles. Very few fruits and vegetables. Eden, Toblerone, medyo social yata sila doon kasi yung nakikita nila. But the point is, this is what's around them, and this is what their teachers put in their food pyramid. This is how they teach kids in public schools here. It's absolutely broke my heart when I saw this, because that is what they think nutrition is. Bakit sinundan naman nila? Water, carbs, fruit, fats. Tama naman, diba? But ano yung laman? Yan. That's the sad truth about many, many places outside where you and I go. So I hope you guys can make a difference one day and change this, even when you're down in Baseco. This is our, again, from the study I just published, the divergence from the Eat Lancet recommendations. And you'll see the protein from beef, lamb, and pork, pero actually that's really pork, 1,500% divergence from the recommended diet. The good thing is vegetables, we're actually hitting the target for that. Not enough roots and tubers, not enough fruits, way too much saturated oil. So we have a long way to go. We do eat our vegetables, but there's other stuff that we have to fix still. In grams, this is what the Filipinos eat, which is an orange. Tinan mo, grains and cereal products. I haven't looked at, I don't know if there's an updated food composition table, but the last one I saw was 2019. Yun pa ba, ginagamit nyo? Yeah, that's still the latest one. And they compile grains and food made from grains in the same table, right? So technically, that means I can eat skyflakes and pandesal and hit all my targets. But that's not the point of it. We're supposed to separate it. We're supposed to create whole grains. That's what we're supposed to eat. The whole grains and not food made from grains. Kaya ang taas-taas ng consumption natin, because chips, bread, pandesal, that's all under there. The good news is the vegetables, okay naman. The legumes, medyo kulang. But you can see there the excess carbohydrates that Filipinos consume. This is just a draft of what I'm working on. So this is the idealized Lancet, the original planetary health diet. That's what it will look like if we fully localize the planetary health diet. I adjusted already the intake for animal protein to a much higher percentage because I think Filipinos can't do without it. We'll never be like that. So it's adjusted. So look out for that. That's something that we hope to promote with our partners very soon. It's not hard, and I'll show you what this actually looks like in terms of a menu. This is our menu for athletes. So this was done by our team of nutritionists, and that's based on about 2,500 calories. They're teenagers, about 17, 18 years old. As you know, they have the highest caloric intake in that whole PDRI table. And what does that look like really in real life? That just looks like eating animal one time a day. That's it. And the rest of it is, you can have eggs, you can have beans, you can have pasta, and still hit all of the dietary requirements. So I put this up here to show you guys, it's not that hard. It's not, you're not kawawa following this diet. Yeah, we used their local fish. Tamarong is one of the local fish found in Ormoc Bay. And we taught them how to make it thigh steamed in a banana leaf. So medyo naging social na siya. But the ingredients, it's just banana leaf, it's just lemongrass. So just teaching people how to enjoy their food in different ways. Hindi na lang ginisa, hindi na lang nilaga. It's the same ingredients. It's not more expensive. It's just a different way of seeing things. But I wanted to show this to you guys so you can see it's not sad to follow a planetary diet. In fact, it'll add a lot of color to your plate. So use food that is available. Use food that you like to eat, except processed stuff. And maintain your basic principles of the planetary health diet. because what you're eating today shapes our tomorrow. So you guys, congratulations for taking up your nutrition and your doctors, becoming doctors. And I hope that you guys will stand with me and be advocates of eating this way for yourselves and for our future. Thank you.
Okay, before you leave, Juana, can we please ask you to stay on stage? Because we're going to take a quick photo. So if I can invite, please, our Manila Bulletin executives, Business Development Manager, Mr. Jordan Tan, Head of Branded Content Group, Ms. Irish Lorenzo, Manila Bulletin Sustainability Focus Session Project Lead, Mr. Philip Gunhing, and Editor of Environment and Sustainability Section, Mr. Ray Ilagan. Please join Ms. Juana here for a photo. What an educational talk that was, right? Nutrition students, yes. It's really, I know it sounds jarring a little bit because when you hear plant-based, it's like, oh my God, it's so strict. But judging from Juana's presentation, her very interesting insights, it's all very doable and applicable. So please promote that, nutrition students. All right, thank you very much. So thank you for that, Juana, and to our Manila Bulletin executives. We'll see you again later. Let's give her a round of applause, everyone. Thank you, Juana. Thank you so much for that. And we'll see her again later during our panel discussion, and you can ask her more questions. All right? So for now, let's continue our program. Let's continue learning. We have our first brand speaker this afternoon. We mentioned earlier, Maxicare. Hello, Maxicare. Maxicare is one of the pioneers in the health maintenance organization industry. With more than 3 decades in the industry, they have provided comprehensive healthcare programs through an extensive network of medical providers and enhanced customer support. To talk about the company's various sustainable initiatives, we'll be joined by the Chief Strategy Officer of Maxicare Healthcare Corporation. He helps drive initiatives that prioritize affordability, preventive care, and efficiency across Maxicare services. And in 2024, he was recognized as one of Asia's top 10 Chief Strategy Officers by TradeFlock. So ladies and gentlemen, let's all give a round of applause and welcome for our fireside chat, Mr. Curly Gakutan. I think one more. Here you go, sir. You can take my microphone first. Here, yes, please have a seat. We'll go ahead. Okay, so I'll sit over here so that I don't block the screen. So first of all, thank you very much for joining us today. We have a lot of students here, as you heard earlier, with very significant courses that we'll learn from our fireside chat today. So before we begin, do you have any short message for our students in the audience?
Thank you for inviting me in this successful event, especially for Manila Bulletin. For the students, I'm actually looking forward to be working to all of you in the coming days because we have a lot of school partnerships that we are working on right now, as well as we're looking forward for an exciting event for different universities that we will be launching late this year until next year.
Perfect. Thank you very much, Curly. So let's get started with our fireside chat, okay?
Just please be gentle with me, okay?
I'm sure. Honestly, this will be fine, but our students later might give you a bit of a challenge.
Okay.
So let's begin. So Maxicare has been actively expanding its network of primary care clinics, or PCCS. Curly, can you walk us through how you're identifying the best areas for expansion and also why accessibility is such a key part for your healthcare strategy? Juana mentioned earlier about accessibility to good products. So in terms of healthcare, can you expound on that, please?
Actually, when we map out our areas for our primary care clinics or our PCCs, we don't just look at pins on a map, but rather we try to look at the life around that area. So it also allows us to ask ourselves questions like, looking at this space, is there a mom right here who cannot afford long trips to the hospitals? Or in this area, is there a lolo who requires regular checkups but finds hospitals overwhelming? For us, when we look at our future sites for PCC builds, we don't just use factors such as the population density or the real estate prices. We try to walk into the shoes of our customers as well, who work and live around that area. Because for us at Maxicare, accessibility is one of our love languages. And when we talk about accessibility, we mean that we try to situate our clinics into areas that we believe we can truly make a difference. These are areas such as locations near office hubs or transport clusters. And we believe these areas will help us promote and touch base closer to our customers. So we believe that, I need to use that point, in order for us to be accessible, we need to be near enough to help as well as fast enough to matter. As of the moment, we already have 35 primary care clinics, but most of it is concentrated into NCR and Metro Manila. But at the end of this year, our goal is to add 20 more clinics that spread all over the country. And even if our intention is to have a total of 100 primary care clinics all over the Philippines by 2028, at the rate that we're going right now, we believe that we can be able to reach that earlier and reach more Filipinos.
Okay, perfect. Good plan then. Thank you for sharing that. Now, now can you tell us, how does the presence of Maxicare PCC, you mentioned earlier, in the underserved areas, how can that part improve patient outcomes and also reduce the reliance on hospital-based care?
First of all, we love hospitals. They are always dependable partners. We are friends with hospitals now. But to answer your question, allow me to use an analogy. At Maxicare, we believe that we play a pivotal role in this healthcare ecosystem now. We are healthcare navigators. And as healthcare navigators, we give you the umbrella before the typhoon hits, not after when you're already soaked. In looking at the map of where we will be putting our primary care clinic, we try to situate ourselves into locations where we can be able to catch illnesses earlier. Because by doing so, we can manage conditions faster and we can help prevent minor illnesses from becoming major emergencies in the future.
Or perhaps like overcrowding
Yes,
in
the
hospitals.
hospital. So the effect of this is better patient outcomes. On the side of hospitals, they will be less stressed and less burdened. And of course, to support sustainability, we will be promoting healthier and more stronger communities, in effect.
Okay, I'm glad you said that, healthier and stronger community, because, Curly, you know how we always say that prevention is better than the cure, right? Especially when we talk about things like cancer. Prevention is always better than the cure. However, in the Philippines, preventive healthcare always or still most often takes a back seat. How can Maxicare, or how is Maxicare shifting this mindset of prevention is better than the cure?
Well, thank you for that wonderful question. When we talk about preventive healthcare, it's actually it actually feels optional for most Filipinos, especially when budgets are tight.
And if they don't feel anything, they're not going to do anything.
So for us, in order to support that preventive healthcare space, we try to make access a lot easier by means of incorporating preventive services such as annual physical exams as well as wellness programs as part of our product design and construct. Because to add to that, we are also actively engaging our customers, educating them through workshops. We do also active participation and school partnerships in events like this. We're also doing a lot of company wellness days, as well as even online consultations. We try to embed health check-ins as part of everyday life, not just a luxury, quote unquote, when something feels wrong. Because at the end of the day, we try to position this preventive healthcare mindset as something which is not scaring people, but we try to put it into a space that is normal, affordable, as well as empowering.
Not intimidating.
Yes.
Or because it doesn't have to be scary. Checkups don't have to be scary.
Yes.
Maintenance doesn't have to be scary.
Before joining Maxicare, I haven't had any annual checkups, but right now I'm required to do frequent visits to hospitals.
I suppose it's like saying, diba, if you have a car, you're not going to fill up the gas when it's empty.
Yes.
Diba? You want to fill up the gas while there is still fuel that can take you to the next destination. Otherwise, masisiraan ka.
Yes,
right?
that's correct.
Curly. Now, in addition to that, because we're talking about preventative healthcare and modernizing everything, technology. We are in the age of technology now. It's part of our lives. We can't avoid it. It's really, the normal state of things now. Technology is playing a bigger role in healthcare than ever before, right? Can you tell us how Maxicare is fortifying its digital platforms to better serve members and stakeholders?
Actually, when we talk about technology, we're doubling down our investments in terms of our systems and platforms, no, in order for us to complement our footprint in terms of our primary care clinics. Because we believe that healthcare should be where you are when you need it. That's the reason why we are heavily improving our mobile applications. We're also upgrading our teleconsult platforms. We are also doing ways and finding opportunities on how we can create faster as well as more intuitive with the help of AI, more intuitive member portals. Because what we want our members to feel is that healthcare is as natural as booking a ride or ordering your favorite food.
Or Gcash.
Yes.
Yeah, very easy.
Yeah.
So just at the tip of your fingers,
Yes.
the click of a fingertip. And you can, if you're able to do that remotely or, on the go, you can even save time.
Yes.
We don't have to worry about traffic. So it's not an added stress.
Yes.
If you have these
It's not
applications.
an additional burden to you. Yep.
Exactly, thank you. Now, how do your digital tools support the continuity of care and make health more sustainable? So you have technology, how can that make healthcare more sustainable in the long
Just
run?
between all of us right here, we're actually investing in a multi-million-dollar, top-of-the-line healthcare insurance system. And that will enable us to integrate our multiple standalone platforms into one. Our intention into investing into this one is that for us to be able to significantly minimize, if not totally eliminate, the friction across our member journey. We're actually, it's part of our 5 strategic thrusts, our investments on data as well as technology, because we believe this will become a critical anchor for us, because we think that digital tools help us connect the dots better. Yep.
Perfect. So now, let's look into the future, Curly. In the bigger picture, what is Maxicare's vision for the future of healthcare in the country?
To answer your question, allow me to do a quick plugging lang of what we do at Corporate Strategy. I'm part of Corporate Strategy, and we spend most of our time into thinking about the why behind the things that we do. And I've been with Maxicare for more than a year now, and I want to share to you guys that our why is simple, but it's very powerful. We exist, Maxicare exists because we want healthcare to become more affordable, more human, and more responsive to the needs of every Filipino family.
Okay, perfect. And how does since we're talking about sustainability today, how does Maxicare define sustainability? And what role do you see Maxicare playing in shaping a healthier and more equitable system?
For the healthcare ecosystem, when we speak about sustainability, we actually support SDG number 3 and number 11, right? It's more of nurture rather than nature. For us, the concept of sustainability means being the market leader currently. It means that we need to be at the forefront in terms of building a healthcare ecosystem that people can rely on, not just today, but also for the coming years. We're very much vested into prioritizing, in making sure that preventive healthcare is prioritized, that our investment in terms of data, systems, platform, and technology make access faster as well as cheaper. That's the term, because affordability was some of the pain points as stated earlier. As well as we help create more healthier Filipinos, not to take care of them when they are already sick. Yep.
Again, which brings us back to our first point about prevention, right? Now, Curly, We have a lot of students here. They are the future of our country.
That's the last question, huh? I'm actually enjoying our discussion.
I know,
Okay.
right? But it's okay because
Okay.
you're still joining us for the panel discussion
Okay,
later.
okay.
This isn't over.
Okay.
And you know, these are the easy questions. I'm sure later our students will have a lot more for you.
Okay, thank
but
you.
for now, what advice would you give to our students here today or young professionals who want to help improve the country's healthcare ecosystem?
As I look around the room, I can see a lot of excited eyes, and keep that passion in you. You will be the face of a healthcare system that is actively transforming. I encourage everyone not to wait for your titles or your white coats or fancy office building just to start helping other people. Because at the end of the day, if we see a need, it's the right opportunity for us to help others. I've been a leader for quite some time now, and what I learned, which I want to share to everyone, is that you always lead with your head, but you also not forget your heart. And for every one of you, I would like to end with this message that your head will teach you the science of healing, but it is your heart that will teach you the soul of it. So
Perfect.
thank you.
Very much. Because can I get a show of hands again from the audience? We had PT here, right? PT here. Anyone else in health? Did we have med tech earlier? Or
we need a lot of med techs.
Yes, we do. We do. So I
and
want.
PT.
Oh, PT, yes.
Well, we will be opening another PT location at PNB Ayala.
Sige, lakasan mo yung applause mo. I can
We have
see you
one right
clapping
now
there.
at Centris. It's top of the line, so you can visit that.
Yes, because earlier I wanted to make sure that we have the students here who will really benefit from your talk, and also think about some questions later, because Mr. Curley will be back for our panel discussion, and we'll be opening the floor so that you can ask him questions. And it can also relate to the earlier topics like nutrition or, health, anything. We have a lot of topics here that are intertwined. So right now, think about it. If you don't have it already, we'll welcome back Mr. Curley later.
Thank you.
For now, let's give him a round of applause, please. Thank you very much for talking about all of that. And we'll look forward to hearing from you later during our panel discussion. Mr. Curley Gakutan, everybody. All right, to continue our very educational afternoon, up next, we turn to the perspective of an academic institution known for producing and training outstanding medical professionals. But while they're setting up, I would like to remind everyone again, if you haven't already done it, please scan the QR codes that are posted all around the room. They're here on the walls, they're right behind you, here on your left and on your right. And please answer the short survey, and this will serve as your raffle entry for later on, where you can win some exciting prizes from our partners. And I'd like to acknowledge them right now. The prizes later are courtesy of our brand partners featured today. Watson's gift boxes worth up to 1,000 pesos. The Medical City grocery packages. AC Health gift certificates up to 5,000 pesos off. TGP care packages, and Maxicare health card. Once again, Watson's gift boxes worth up to 1,000 pesos, the Medical City grocery packages, AC Health gift certificates up to 5,000 pesos off, TGP care packages, and Maxicare health cards. The winners will be announced after the program, so stay tuned and make sure you stay till the end. All right? So next, everyone, to talk about producing and training outstanding medical professionals, let us all welcome the Chief Dietitian of UST Hospital, Dr. Maureen Sarmago.
So good afternoon, everyone. Are we still awake? Gising pa. Baka may nagpo-food coma na sa inyo. Are you familiar with food coma? Di ba? After we eat, you kind of feel sleepy. Wala rin naantok? Dapat wala. Okay, so my topic for this afternoon is of course, the UST Hospital programs and initiatives to promote proper nutrition and sustainability. Okay? Next, please. Ayan. So, what happened to my slide? So, okay, let me start my lecture, no, my talk with iconic quote. Alam na, nutrition students, you know this, right? Let food be thy medicine, and medicine be thy food, which you know is from whom? Andiyan na rin naman, Hippocrates, right? The father of medicine. I'm sure this, for nutrition students and dietitians here, this resonates to us, right? Kasi it kind of reminds us of what? That we have what? That yung every diet plan that we make, diba, that we create, or every meal we prepare, can contribute to the healing of our patients, right? Or overall wellness, no? Importante. And really, we have a role, no? It also reminds us that we have a role in addressing the nutrition-related problems of our time. Meron ba tayong problema ngayon sa Philippines in terms of nutrition? Yes, no? But since I'm from the hospital, I will start with this issue first, no? Okay, malnutrition in hospitalized patients. We know that mataas siyang rate na yan. Just 50 to 70% of all our admitted patients could be malnourished or at least of malnutrition. So we know, may consequence yan if they are malnourished, that could actually lead to what? Increase in their infection rates, right? And they could have what? Reduced or delayed treatments, and of course for them, longer hospital stays, and also higher hospital costs. Do you agree? Agree naman tayo, no? So with that, of course, with us, from dietary department or as dietitians, we want to address this concern. So next, please. And we have actually initiated the following. We have adopted, I don't know if you're familiar with this, the Department of Health Administrative Order, which is on the guidelines on the implementation of nutrition care process in hospitals, in both private and government hospital. Now, with this guideline, actually, with this directive, now it makes it easier for us dietitians, in identifying the problems of our patients. Because with this directive, saan yung mga nurses natin dito? Nurses, future nurses, yes, kayo. Nakita ko kayo, So, with this guideline, pagdating niyo sa pag nag-work na tayo sa hospital, you are now in charge of doing the nutrition screening of our patients, all patients upon admission. Now, with that, siyempre lahat na na-screen natin that are at risk of malnutrition should be referred to us by our doctors so that we can, again, come up with a sound nutrition care plan for them. So, again, with this, actually, sa totoo lang, it's not yet 100% or perfect yung ating implementation, but at least nakastart na tayo with this directive. Okay? Next. Ayan. So, take note that again, to address malnutrition, we make sure that we provide our patients with individualized or personalized nutrition management. When I say individualized, right, there's no one-size-fits-all management. Okay? Every patient is different. Okay? We have to consider the nutritional status, ano ba? Diagnosis, of course, medical condition, their food preferences, their cultural beliefs. All of that should be considered. And ganun then, of course, we should base our management with what? Updated guidelines, right? And also with evidence-based. Lagi kang ganito, evidence-based recommendations. Where do we get our recommendations? Of course, it should be from our credible medical and academic organizations, such as what's seen here. So hindi lang basta sana isipin lang natin. We have to have evidence, of course. Next. Ayan, so UST Hospital actually believes in the strength of collaboration, para we could provide comprehensive, and holistic care. We actually work hand in hand with the different health professionals, with the doctors, nurses ulit, We always collaborate with the medtechs, of course, pharmacists, lahat yan, to be able to come up with the best patient care, Ayan. And next, we also give them ito. There's a saying that no food is nutritious unless consumed. Agree? Di ba? Like we dietitians may come up with parang napakagandang diet plan, meal, di ba? Parang hindi naman kinain ng patient natin. So hindi siya nutrition. Walang nangyari, right? So again, we consider that. We always make sure also, we try talaga to come up with safe, nourishing, appetizing meals. But there's always a challenge with this. Alam niyo kung bakit? Pag sinabi kasing hospital food, na-judge na siya. Di ba? Anong ating tingin sa hospital food? Hindi talaga masarap. Hospital na ba kayo? Try nyo sa amin, masarap. Okay, joke lang. Okay, of course, no, alam nyo, that is really a challenge, no? Kaya nga, kami din, no, but take note, sabi nga kanina, when there's low salt, di ba? So we're not used to low salt diet, so some really complain na hindi masarap. But again, that depends on their specific diet. But still, we're making effort pa rin to improve this one, no? Actually, last time, we have collaboration with, CTHM. Nasaan yung mga taga-CTHM dito? Wala na, ayan, no? Actually, we invited the chefs from CTHM to have training with us, to train our people, no? To improve our meals and our meal presentation, okay? Ayan. So next, of course, no, to empower our patients on how they can manage their condition. We provide them personalized and practical, going back, please, pakibalik po. Ayan, nutrition advice, diba? So we know this, sa mga nutrition students, we always ask them, what's the goal? Diba? Pareho tayo ng goal with our patients. So again, we need to provide them, diba? Na sila mismo makapag-manage they have their meal plans, diba? And also the relatives, no? To be part of the counseling para sila lang sa pagdating nila sa bahay, they can also manage their condition. And next, we also have this, no? We conduct, no? We believe, like kanina sinasabi lagi, preventive healthcare, no? And again, we also have this program in our hospital. We conduct, no, nutrition seminars for our outpatients. And anong mga focus natin dito? Of course, kasama naman about management of conditions, no? Right now, we have memorandum of understanding with CKD or chronic disease clinic, no, of our hospital. So kasama kami sa management ng mga patients nila. Same with, we also have now collaborations with BCI, no? So we have dietitians there attending the meetings, no, regarding treatments of our patients, no. So kasama yan. It's again collaborative. So, and we also have partners with Department of Pediatrics of the hospital. So dietitians, no, ang dami nating trabaho actually, and marami tayong pwedeng gawin actually sa hospital. And so this one, we are focusing here, for example, on infant or child nutrition or maternal nutrition, no, to again teach our mothers or how to feed their kids. And this one, may mga lecture din kami with CKD patients. Okay? All of these efforts are actually centered on providing, of course, the best, no, patient care. We believe that next, efficiency in patient care with our collaborations, different health professionals, we can provide the best care to our patients. Meaning, gagaling sila agad, tama ba? Hindi na pa ulit-ulit yung mga blood test nila, We can diagnose already the problem right away. And I believe, no, that actually can lead to sustainability. Okay, that can reduce, again, resource waste and also optimize energy, water, and materials in healthcare facilities. Do you agree with that? Ang UST known for a high-quality patient care. Sana agree ba tayo dito? Hoy, tumasyans tayo. Wala nag-agree sa akin. Are you still awake? Gising pa ba tayo? Okay. So aside from this, of course, initiative, we also are aware that aside from malnutrition in patients, in our admitted patients, we also have another issue that we address, Next, our country still suffers from the triple burden of malnutrition. Okay, so this is based on the Expanded National Nutrition Survey of 2023. And we can see, that we still have problems in terms of malnutrition among Filipino children and adolescents. 30% daw of Filipino children are stunted. Kasali kaya tayo dati dito? Hindi naman siguro, no? No, joke lang. Okay, so we still have 30%, and we still have 2 in every 10 children are actually underweight, and among adolescents, stunting is still there. Aside from that, next, please. Macronutrient deficiency. Okay, mostly now it's more on iron deficiency. Okay, and the most vulnerable groups for this one are, sino ba? We have our elderly, we also have children, yes, and also pregnant and lactating mothers. And sabi natin triple burden, what's next? What's next nutrition problem after micronutrient deficiency? Hi, mga nutrition students, triple burden. We have undernutrition, we have micronutrient deficiency, and lastly, ang galing ng mga nursing students dito. Babawi kayo ha, nutrition students. And di ba? Sige, sorry naman. Okay, this is quite alarming, no? Like they say that 3 in every 10 adults are overweight. And 1 out of 10 is obese. I-add nyo yan. 4. Di ba? 4 in every 10 adults are actually overweight and obese. Kung tayo ay 200 dito, so ilan kaya dito yung overweight and obese? Kung i-base natin with that 40%. So ilan yun? Of 200. Nahirapan din ako mag-compute. 200 0.4. 80. 80. Totoo kaya? Parang hindi naman siguro. Totoo ba? Okay. But I also want to share this one. Next slide, please. Okay, kasi yung ginamit sa una would be, it's the WHO classification of BMI or body mass index. But if you will use Asia-Pacific criteria, what it's showing is it's not just 4. Okay? It's already 5 out of 10 or 50% of Filipinos could be classified as already overweight and obese. Parang ako, for me as a dietitian, it's really nakakatakot and alarming because we know, alam natin that obesity or being overweight and obese is one of the risk factors on the development of what? Chronic diseases, like non-communicable diseases. Okay? Parang sinasabi lang dito na ang dami natin magiging pasyente in the future. Do you agree? Yes. Parang wala nang sumasagot sa akin. Yung mga interns ko dyan, or are you? Ayun, gising pa sila. Okay. So next. So yun din ang next point ko dito. We have still, the trend of non-communicable disease is actually increasing, right? Sa hospital na lang, di ba? Ang dami naming pasyenteng diabetic, with cancers, cardiovascular diseases. And based on this, according to WHO, 7 of the 10 leading causes actually of globally were actually non-communicable diseases. Okay. So tingin nyo, what's the impact on our healthcare with this one? Ano kaya ang impact niyan? Okay? So, sabi ko nga, ang dami magiging pasyente in the future. Okay, next. So, with that, in response to this, because we want now to also focusing on preventive nutrition, okay, in the hospital. Okay, so we're coming up with programs, initiatives, to promote healthy eating habits na lang. I'd like to mention natin previous speaker, Ang dami nasabi kanina, like promotion of healthy diets we say healthy diets, alam natin yan, with increased consumption of fruits, vegetables, whole grains, nuts, and legumes, right? And lower consumption of, can I hear some of the nutrition students here? Fast foods daw, because they are high in, nagturo na ako. They are also because of saturated fats, trans fats, sodium, cholesterol, right? And also, of course, not ito kasi hindi pa masyadong na-focus, but yung sugar, no, intake of sugar, that's too much among kayo, sa mga estudyante now. And then we know that can also increases the risk for many conditions, no. Ayun, and also, our programs also focuses on weight management, okay, achieving of course, ideal body weight and desirable body weight. And ito, kasama namin lagi sa programs namin with our personnel, our employees are the PTs. O sino mga taga-PT, mga PT dito? O, pagpunta niyo sa hospital, o, gigisingin ko kayo. Actually, no, you also have a role in preventive healthcare. Kasi di ba, you have to emphasize the importance of being active or, di ba, being physically active. Kasi kailangan pa rin yan. Okay? So, we have these programs, no? Una muna sa empleyado. Bakit empleyado din? Okay? Because we believe that we have a strong and healthy personnel, di ba? That also equates to a strong, no, foundation of a strong workforce that can provide high-quality patient care. So yun yung talagang pinupokus. So our administration is very supportive with these projects. So aside from the seminars, and mind nyo pala, hindi lang kami to, ha? We have collaborations again with the Human Resource Department of our hospital. We have the Apolinario Mabini Rehabilitation Center, and also the different services, no, family med, cardiology. So again, nephrology and others pa, no. And next. Ayan, so last April, the first week of April is Health Workers Week. And pinasok rin namin ang nutrition, of course, no? We tried to again recognize our personnel by having projects focus on, again, healthy eating, no? We provided them healthy breakfast, kasi breakfast is, ano si breakfast? The most important meal of the day, and also we provided them snacks, no? Healthy snacks pa rin, syempre, no? And try to give them healthy gift packs, yan. Mayroon din kaming fruits from our management, no? Diba? Nutrition pa rin. Sabi nga, an apple a day keeps the doctor away. So yung mga ganung nutrition messages namin, okay? Ayan. So next. Ayan, so this one, we also have this Nutri-Olympics. We partner with when the hospitals having their sports fest, we partner with them, no? We have our Nutri-Olympics. So in Nutri-Olympics, parang mga lang to parlor games, but focusing pa rin on how can we create awareness on healthy food choices. And mind nyo, alam mga snacks namin ditong binibigay. Na-mention kasi ni Ma'am kanina, like we give boiled saba, boiled corn, nuts. Yun yung mga piniprovide namin snacks during this event. Again, we are teaching them, no, healthier food choices. Okay? And of course, the importance of physical activity. Okay? Another program that we had, of course, this one, hindi na to pang empleyado. It is open to the USTH community or UST community as a whole. Even patients and their relatives, we allow them to join our activity. Nutri Fiesta is our yearly celebration, parang pang kick-off namin for Nutrition Month celebration. And this, during this event, we actually conduct pre-nutritional assessment and nutrition advice. And we give them also, may mga pag-games din kami dito, kaya nga fiesta. Our games, no, fun, engaging games, still focusing on nutrition. Okay? Ayan. Kasi para mag-join sila. Tama ba? We have to, as dietitians, kasi we have to come up, para ba magiging creative way, no? To put, para mag-spark ng interest on good nutrition. Same with this one, Nourish to Flourish naman sa activity, we had, as a start of, a celebration pa rin of our USTH anniversary. Same lang, we have bone scan here, we have nutrition assessment, diet advice, and again, engaging games for our community. Next. Ayan. Kasi di ba, we keep on teaching them na ito yung healthy, but again, hindi naman siya readily available. So, we actually had this project to, again, promote also consumption of fruits, vegetables, no? Healthy fruits and vegetables pa rin yan. Okay? whenever I ask people, no, like mag-lecture ako, what comes to mind with nutrition? When you hear the word nutrition, most of the time they say fruits and vegetables. So there's already that, di ba, awareness or knowledge na talagang healthy sila, okay? Kaya when you ask them, meron ka bang intake ngayon ng fruits or veg? The answer is, wala. Wala naman, okay? Kayo din ba? Yung mga taga-PT dyan, sino sa inyo nakakain ng fruit today? Meron ng fruit intake for the day? Meron na ba? Wala. O sige, sa nursing, any fruit lang. O, may isa. So, anong kinain? Banan. Mango. Very good. Nutrition students. Oh, dapat, di ba? Ayan. So, that's the purpose of this activity. We make it available for them. Napansin namin yan. We also have this, during our Nurse to Flourish activity, meron kaming pa-free food. Bipili ka ng price mo between bread and fruit cups. I was expecting that they will choose the bread. But no. Actually, naubos na yung kinuha lang na yung bread, yung ubula na yung fruit cups. Okay, so I guess it's the availability that's one of the concern. No? Kaya hindi tayo kumakain ng fruits and veg. So that's the purpose of this activity. Next. Okay, so of course we also provide this one. No? So our indigent patients, we provided them pre-nutrition counseling. Again, focusing pa rin on healthy eating, of course, that can reduce, of course, the risk of chronic diseases and others. Ayan, so next. I don't know, we have a page, no, our department, the UST Nutrition and Dietetics Department, and we have this social media posting, of course, no, focusing pa rin on nutrition. Actually, ito, ginagamit namin ito yung mga gawain ng mga students namin, okay, ng mga interns namin. Okay, for example, sorry, hindi malinaw, but again, different nutrition messages, no, practical nutrition messages that you can apply, no? Ayan. So with that, ayan. So we believe, no, with preventive nutrition, it can promote sustainability. It can contribute to sustainability because, diba, it can reduce the burden on healthcare systems. It can minimize the environmental and economic cost of managing advanced diseases. Nandun tayo sa ulit-ulit kanina. Prevention is better than cure. No? Hindi tayo lang sa hospital para cure lang, no? But no, we can also promote, diba, prevention. Ayan. So I also included here, next please, some sustainable practices, no, that we try to do in our department. We're starting with this one. Of course, promotion of plant-based diets. Na-mention na ni the previous speaker actually, na nag-explain niya maayos, no, maganda, no? How can plant-based diets promote planetary health? And slowly, actually, alam naman natin that it's actually good, right? And being, di ba, sabi natin, lower in sat fat, di ba? Walang cholesterol, ayan, no? And higher in fiber, higher in antioxidants, phytochemicals, and all. So it's important. Actually, it has a role in managing or preventing a lot of conditions, no? But, actually, isipin din natin, with pinggang Pinoy, tama ba? Pwede na siya, di ba? Plant-based diet na rin siya. We just have to focus on telling our patients, that they should have whole grains. Tama? Hindi mga white bread, okay? So yung mga corn, ganyan, no? So as part of their pinggang Pinoy, kasi pag titignan mo naman ang pinggang Pinoy, only if you know, sige nga, I'll check nga if they still know their pinggang Pinoy. How many % of the pinggang Pinoy is parang per protein? Allotted per protein. 25 ba? Are you sure? Hindi, it's not 25. It's only 17%. Kasi half of the plate should be fruits and veg, 33% should be your whole grains, grains, right? And then 17% for yung meat, fish, no? Ayan. Or now, we can also use, di ba, nuts and legumes and seeds, right? Ayan. Okay? So with that, also have nutrition telehealth. No, we also providing now online diet consultation, no? At least, di ba, sabi nga, hindi na sila pumunta sa hospital, so yung gas emissions would be lesser for those patients, di ba? Ng mga pasyente natin na yun. And also try to work on our food waste, no, reduction by making sure that, syempre, yung tamang preparation, and we monitor the tamang portion control, no? We monitor the plate wastage, no? Actually, totoo lang, before we give 1 cup of rice, and now we're just giving 3/4 cup. Kasi nakita namin, hindi naman nila kayang ubusin yung 1 cup of rice. Okay, that's one. And also, we are, syempre, bulk cooking to lessen the energy costs, no? And we are now investing. Our management is very supportive with this one. We are now investing on equipments that are actually energy saving or can lower the usage of water and energy. Ayon. So, again, the hospital is very much, of course, supports the vision of sustainable healthcare. That's why we have these programs, no? Again, we are focusing on providing pa rin excellent healthcare, patient care, and preventive nutrition. Ayan. And also this mga initiatives, no? We still have a lot of things to work on, we know that, no? Like, if some of you have been hospitalized, no, sa USTH, we're still using actually disposable, wares. Medyo may mga, pa tayo, no? Hindi pa talaga siya wares, or hindi pa sila environmentally friendly, but we're working on that already. Ayan. And also, we believe also, no, we have excellent training. I don't know if my trainings will agree with this, no? I believe that also, di ba, if we have, magagaling, or, ito na yun ito na papasok ang ating UST values. If we have competent, committed, and compassionate, tama ba ako? Healthcare workers in the future, syempre kayo, no? That also can, again, that would contribute to sustainability because we can provide the best patient care to our patients. Okay, so let me end my talk with another quote, but this one is by Mahatma Gandhi. So sabi dito, the future depends on what we do at the present. So marami siyang pwedeng pasukan, right? So sabi nga kanina, if you, kayo, be healthy, may mga message kanina that you should be healthy, tama? Take care of our health, let's start now. And we try to, again, also focusing on sustainability, kung ano pwede natin gawin to, again, to take care of the environment. So we should start siguro now at present, no? So again, that's all. Thank you all for your kind attention. Okay.
Thank you very much. Thank you very much, Dr. Maureen Sarmago. It's really nice to hear that we have a lot of preventative measures, right? Very good. Thank you very much, Doctor. Let's give her another round of applause, everyone. Thank you so much for that. Very insightful, and I promise, guys, this is the last reminder. Please scan the QR codes on your left, on your right, and behind you, and answer the short survey because this will serve as the entry to the raffle later. You can win some really exciting prizes from our partners today. So if you haven't already, please take this moment to do that. Take a few seconds. It's a very short and quick survey, and we will see you later for the prizes. Up next, the next company to share in their sustainability initiatives started out as a small pharmaceutical company in 1949. They are focused on providing generic medicines for Filipinos with affordable alternatives to quality medicine, known as the Generics Pharmacy or TGP. We are honored to be accompanied by the head of corporate affairs for Robinson's retail drugstore segment, South Star Drug, Rose Pharmacy, and TGP. She is a change maker in healthcare and policy, leading corporate affairs for Robinsons Retail's drugstore segment. With a strong background in economics and public service, she bridges sectors to drive meaningful and community-centered centered change. Everyone, please welcome on stage Miss Carol Malena.
Thank you.
Good afternoon, Miss Carol. Oh, careful, watch your step.
Good afternoon. Thank you for that kind introduction. Hello, UST. Gising pa? Louder, please. Gising pa? I promise, I hope, I'm already the last, right? I promise this would be very engaging. I hope you do get a lot from us. Again, good afternoon. I am Carol Malenab, and I'm here to share the story of TGP. Okay? So our presentation is entitled, From Prescription to Purpose. Bakit from prescription to purpose? Kasi actually ako, personally, I really believe in the purpose that TGP holds. Okay, so just to share, a quick overview lang, baka hindi natin alam, TGP is part of Robinsons Retail. This is like our mother. And Robinsons Retail has 5 segments, 10 formats, 22 banners. Makikita nyo, andun kami sa drugstores. TGP is there together with Southstar, Rose Pharmacy. TGP's model is a franchise model, while Southstar and Rose Pharmacy are all company-owned. Yan. So when you see the logo of TGP, anong nakaalala nyo? Can you just shout your answer? Anong unang pumapasok sa isip nyo when you see the logo TGP or when you hear TGP? Affordable. I can hear affordable over here. How about here? Sorry? Generics? Dito sa gitna. So we have affordable, generics dito. Pharmacy, okay. So probably when you hear the name TGP or when you see TGP logos, unang papasok sa inyo, of course, affordability, murang gamot. But you know, actually, there's a bigger story or there's a story behind TGP. Our founder, Mr. Benjamin Luzon, really saw the Filipino drive and innovation. How do you marry this together to create healthcare within reach? So how did we start? How did TGP start? It started in 2001. 2001 is when TGP started to go into retail. Kasi nung before wholesale sila, so inaangkat nila, tapos saka binibenta. But in 2001, they started doing retail. And really, the goal was to make essential medicines affordable, abot kaya, accessible, abot kamay, makukuha mo agad, and trusted. Because the landscape then, back in the 2000s, pag sinabi mong murang gamot, anong unang pumapasok sa isip nyo? Sorry? Generics? Ay, walang gusto magsabi ng medyo nakakalungkot na perception on murang gamot. Anong unang pumapasok sa isip dati? Pag sinabing mura yung gamot mo. Sorry? Hindi effective. Hindi trusted. And that's what TGP really plans to change, wants to change. That generic medicines are to be trusted. Because quality care is a right. It's not a privilege. Tama? Hindi mo kailangang gumastos ng mahal to have quality care. And marrying that healthcare, TGP also empowers communities because Mr. Benjamin Luzon, again our founder, saw that, Filipinos, they're very innovative. They're also natural entrepreneurs, right? So why don't we build pharmacies empowered by the people in the communities? So in 2007, that's when the first franchise of TGP opened in Pasay. So from one store in Pasay, we are now 2,000 and plus strong, all over the country. So we serve communities not just in the big cities but also in underserved barangays. So before the program started, we saw yung mga classmates nyo, mga schoolmates nyo, they were being interviewed, right? And I heard one of them saying, yun yung isa sa problema sa healthcare ngayon eh. Lahat nagkukumpul-kumpul sa mga cities, sa urban areas. Paano naman yung mga nasa malalayong lugar? Sino namang mag-serve sa kanila? Paano sila mararating? And that is the goal of TGP, to have affordable and quality medicines accessible to everyone. So we have a purpose in action. This is just some of the things that we do. We go to barangays, we go to different rural communities because we want to show that, healthcare, quality and affordable healthcare and entrepreneurship can go hand in hand. Because we want to empower families to have access to affordable healthcare and through marrying that with sustainable livelihood. So yung mga franchises po ng TGP, yung mga franchises ng TGP, they are part of our mission. They are part of the overall mission to have affordable and accessible healthcare reaching different communities while having a sustainable livelihood. So the future of healthcare, that's why we are here. We want to talk about sustainable healthcare. I'm sure you know this. Healthcare is becoming more digital, very AI-driven, very data-driven also, and very disruptive. But despite all of those technological advancements, no one can replace you, the soon-to-be frontliners. That human connection with everyone that you meet, walang makakapalit doon. It's because people will always matter more. And that frontliners, kayong mga kinabukasa, mga future frontliners natin, you will be very crucial. You will remain to be crucial to this entire landscape. Kasi walang makakapalit, walang AI or tech or app na makakapalit sa compassion. Sa compassion na dala nyo pagkaharap nyo na yung mga pasyente, yung mga nangangailangan, sa tiwala, di ba? Sa tiwala natin sa tao at sa kausap natin, and in community leadership. Just also to share, and we've mentioned this earlier also by the other speakers, this is pretty alarming, rising chronic diseases. Did you know that younger adults are increasingly affected by chronic diseases? Marami na sa age nyo, natin, o parang youth din tayo, ang nagkakaroon ng hypertension. Dati yung hypertension, sakit lang yan ng mga magulang natin. Pero ngayon, nagiging sakit na rin siya ng mga kabataan. And of course, andyan na rin yung health inflation. High out-of-pocket expenses. Mataas pa rin siya. That is why the frontliners, kayo, and this is an encouragement to everyone here today, your role is to help communities stay healthy, manage the chronic conditions early, and to keep healthcare accessible and affordable. And in TGP, andun kami, what is sustainability for us? So often when we hear sustainability, we think of the environment, like a greener a greener culture for everyone. But at TGP and for healthcare, we also believe that it means that you're able to maintain your business last longer para mas marami kayong maserve na communities. That's why these are just some of the things we do. We continue to do digital transformation. We engage in different pilots. Telepharmacy, baka yung mga pharmacy students dyan, is something we are working on. And also we work closely with our government agencies for different health campaigns and advocacies. Because sustainability, more than a big banner project, in TGP, we believe that sustainability is doing right by your customers and by your partners every single day. And it's not just a side project. It's how you work consistently, deliberately, and with care. So in Robinson's Retail and in TGP, it's part of our DNA. It's part of what we do every day. And just to share, can we play this video po? From the tech booth, yes. Gusto lang namin i-share yung, hindi po ako kakanta, pero may makikita kayo sa video, na siya ang aming
Kung
brand
4 lang dito ang kasya sa budget mo, anong uunahin mo? Huwag mong bitawan ng maintenance. Meron namang abot kaya at di kalidad na gamot. Paano mo magagawa ang ibang bagay kung wala ka na?
So this is Oplan TGP. Kung makikita natin kanina, merong isang tao, may hawak siyang iba't ibang bola. Merong maintenance, ano pa ba mga iba't ibang expenses niya. Tapos papasok si Sarah Geronimo, the one and only pop star. Sasabihin nga, kung meron kang bibitawan sa isa sa mga ito, ano yun? Alam niyo, ang una nilang binibitawan, yung kalusugan o yung gamot. Kasi ang sa kanila, kailangan ko magbayad ng rente. I need to buy food, of course. Kailangan ng pambaon ng anak ko. So siguro ito na lang maintenance, pang sarili ko lang to, ako lang naman yung maapektuhan. Ito na lang muna yung i-forgo ko. And that is the sad reality that we're still facing now. And in TGP, that's what we emphasize. You don't have to spend so much just to make sure that you're able to have your maintenance medicines. Sorry? Ayan. So to end, we'd like to share that, just like our founder, Mr. Benjamin Luzon, who back then had this wonderful, bright idea and that belief in the Filipino spirit, that I can help make that change. Make healthcare more affordable and accessible to everyone, and to empower the communities to have a sustainable terms of livelihood. Because you don't have to wait for the perfect conditions to have change. Kapag nagsisimula ito when ordinary people like Mr. Benjamin Luzon then, like you, like me, like all of us here, choose to make healthcare more human, more accessible, and lasting for every Filipino. So I'd like to emphasize on that we all can do something about making healthcare more human, more accessible, and more lasting for every Filipino. So that's it for TGP. Thank you.
There, Miss Carol Manahan, thank you very much for sharing that with us. Now, please don't leave the stage yet because you're going to be part of our panel discussion. Okay? So everyone, now while we're setting up the stage, we would like to encourage everyone, let's pay attention to our speakers, to our panel discussion, because I'm sure Miss Carol, maraming mga tanong later from the students. You'll look forward to it?
Yes, of course.
Ready to engage because there's a lot to discuss, and as you say, a lot to make healthcare accessible. And I really love that the trends now, especially in this afternoon session, is all the speakers spoke about sustainability and preventative.
Yes, because it's all part of that great landscape of making every Filipino healthy.
Okay, perfect. Thank you very much. All right. Miss Carol, if you'd like to take your seat here, we just have one last chair. And with that, everyone, we would like to call on the rest of our afternoon speakers for our panel discussion. Let's welcome back Mr. Curly Gakutan of Maxicare. And also Dr. Maureen D. Sarmago of UST Hospital. Let's also welcome back our keynote speaker, Mesa ni Misis, Miss Juana Manahan Yupangco. And last but not least, from the Manila Bulletin, Mr. Philip Kuning. And we'd also like to call on stage a member of the faculty from UST, Chair of the Department of Nutrition and Dietetics, Assistant Professor Kathleen N. Cruzada. And their student representative, Matea Samantha Marasigan.
During COVID, generic pharmacy sponsored our roving palengke.
Okay. So good afternoon again, everyone. Let's give our panel another round of applause as they begin. And I will now turn over the floor to Mr. Philip Kuning.
I just wanted to ask a few questions just to get it rolling. No, like in terms of nutrition, the impression always has been if it's healthy, if it's organic, mahal, diba? And you're trying to debunk that, obviously. But what is the resistance to that debunking, and why is it so hard to get that message across?
Okay, so that organic is mahal or vegetables mahal naman talaga eh. Totoo siya. And in the Philippines, they're just starting to do a certification, diba? For organic na official. It's not like in the States, it's not like in first world countries where totoo siya. It's just in its infancy. And the reason it's expensive is because the production is so konti. I don't ever say na eat organic. I say eat vegetables. Kasi yung organic naman, if you can, kung may kaya ka, for the green leafies, the stuff that you eat raw, but the rest of the stuff, you cook it, you boil it naman. So, I don't know if I answered your question.
The follow-up to that is like when you think about superfoods, everybody will think broccoli, kale, quinoa. Why is it so hard to market and make Filipino, like you were saying, mustasa, as healthy as broccoli? And yet nobody will think mustasa. I mean, how many people in this room will be thinking of superfoods and automatically think mustasa? No? Is there really a problem with marketing locally grown vegetables?
Yes, absolutely. And I think this goes back to before our time na, you know,
My generation.
yeah, or more pa, yours in the 1800s. But of course, the belief was that the more meat, the more prosperous you are. Mahirap ka kung gulay lang kinakain mo. It's that mentality that we have to try to debunk. I always tell a lot of people, mga mayayaman nga, puro gulay na nga kinakain. So, dapat ganun din kayo. Or, you know, like try to encourage that. It's a mindset that we have to break, and I hope the future students and doctors and nutritionists here can help us with that.
And then I'd like to shift now to Maxicare. No? I mean, you were talking about preventive and all these things, but what is the penetration of HMO like here in the Philippines right now?
Actually, if you look at the total healthcare spend, last 2023, it's about 1.2 trillion pesos, and we're projecting it to be around 2.1 trillion. And out of that pie, in 2023, the total healthcare spend is around 44%. HMO plays about 6 to 7% of that out-of-pocket spend, of that total healthcare spend. And we try to look for products and services in order to widen that scope and promote inclusivity, because that's our major tenet in terms of sustainability.
But so for you, what the stumbling block there is more the mentality of the average Filipino?
In terms of, we have a long way to go in terms of championing preventive healthcare. It will be beneficial for all of us players here in the healthcare system. In terms of the mentality, as pointed out by Carol earlier, it's always a trade-off between healthcare and other things that they need to prioritize. So for us, we try to position ourselves into areas where we can promote more education in terms of these preventive campaign by partnering into critical stakeholders like hospitals, pharmacies, nutritionists. Will be making a project hopefully later, and then try to instill into everyone that your position, your mindset in terms of promoting that preventive healthcare is very critical, because we tend to eliminate it from snowballing into major emergencies in the future.
And then I don't want the TGP to feel left out. No, but my question is like, is there a marketing issue prevalent with generics in terms of how to, no? Because I don't think a lot of people realize that with generics, and correct me if I'm wrong, no, it's just a matter of certain medication formulas, the patent having already lapsed, so that now anybody can produce that kind of medicine, and yet people feel that if it's generic, it must be cheaper, but also the quality also suffers, no?
Yes, so we've come a long way already because we already have the generics law, right, which encourages doctors and even hospitals to promote generics, meaning pag magre-reseta ang doktor, wag nang ilalagay yung brand, just put the generic name. And that's been very helpful in terms of knowledge sharing and making people know that, you know, branded is just as effective, generic medicines just as effective as the branded ones. But unfortunately, probably there's still that mistrust, probably because of the proliferation of fake medicines in online platforms. It's been very hard to police the pharmacy industry in terms of like, okay kami, kahit mura yung gamot namin, ito pinagdaanan talaga yung FDA registration and all of those. Pero yung mabibili mo online, kahit na it carries the name of a branded, because it's fake, nahihirapan din kami i-combat that. So kami sa TGP and also the other industry players, we work very closely with the Department of Health, also with our different legislators to make sure that the implementation against fake medicines is there, may ngipin yung batas, para hindi naman malulungkot yung mga kababayan natin na bibili ng gamot online. Akala nila branded yung nakukuha nila, tapos hindi pala effective. Sasabihin nila, kasalanan yan nung manufacturer or nung gamot. So sana may ganun. That's what we're trying to do in the industry right now. And we're very, very grateful sa DOH and even with the FDA for helping us work closely to that goal.
The faculty members of UST, I'm sure, have questions.
Actually, when you look at the healthcare as a whole, yung misconception, because we're talking about misconception in nutrition, the pseudo-nutritionist, even in pharma or other programs, no? When you look at it, it boils down to education. So let's review the curriculum, no, ng buong basic education. We have MAPE. So the health there is only part of MAPE. And yesterday, I read on Manila Bulletin, I suppose, yung parang may, it's about DepEd, na they would like to combine MAPE and social studies, yung araling panlipunan. So imagine health is only part of MAPE. And then you will integrate. I don't have problem with integration of courses. Actually, for us to educate, to give nutrition education, we really have to integrate that to different courses. But let's take a look at the overall content of the curriculum or the topics that we discuss. So let's say stunting. When a child is already stunted, basically irreversible ng effects nun. So we keep on doing feeding programs, but you include there children who are already stunted. I'm not saying you don't do that, but lagi siyang nasa backside. And in public health and in health, sadly, nutrition is also at the backside. Parang politicians, for instance, they will not give you projects related to nutrition. Why? It will take months to do feeding programs. And like if you will give something tangible, people will see, ang galing. But nutrition, it takes time to really have the effect. Plus, another thing, when nung nagka-pandemic, I told myself, if there's a silver lining about nutrition, people became aware. Remember those days, during those time na there's no medication, there's no vaccine then, the only thing that matters then is how to have a robust immune system. People, we receive so many invitations, Ma'am Mau can attest to that. No, we receive so many invitations for companies talking about basic nutrition, school. So imagine you only realize us that we're there in the public health ever since, but you realize that because you need us now. What I'm saying is, let's take a look at the curriculum. Baka kaya madaling ma-affect tayo with whatever misconception. It's because, yun nga, there's no food education.
But would you also say most people have forgotten already the lessons from the pandemic?
Probably. But actually, there's a significant change in the 2023 National Nutrition Survey because we just launched the National Nutrition Survey in 2024. That's the 2023 version. So there's a significant change, but still the same. We have triple burden malnutrition. We have stunted children. We have micronutrient deficient individuals. So we really have to take a look, 360 degrees siguro, no, of how we will educate people. Kasi there's a question earlier regarding it's expensive to eat vegetables, but it's simple. Movaba. Moderation in everything, variety in what we eat, balance in everything that we do, even physical activity.
Just to add to what you were saying, it's just the whole system. I do feeding, or they get me to do feeding in public schools with some more enlightened principals who see the benefit of having us come in. And yung wala silang nutritionist. It's a nurse who's, they're not really a nutritionist. And then it's a teacher who's stuck with a feeding program and she hates her life because she has to listen to me and she has to force people to do it. Like they're not happy. They're not getting paid extra for it either. So it's hard when even with that, parang siya na nga yung nutrition teacher, they still didn't know how to portion the food. So parang I had to like go back to basics, take pictures every day. You send it to me every day. And then we had to prepare everything in bulk na ito yung bibilhin nyo sa grocery, ito na yung for every day. It's a whole broken system that's, it needs to trickle down to fix it.
Okay. Sa akin naman, no, in terms of our practice in the hospital. So, importante, no, as, again, future dietitians siguro, and sa amin din, no, that we, sinasabing mahal, but you really have to be familiar also, no, with what are readily available or accessible dun sa, we teach them na ano yung meron, ano yung tinatanim sa lugar nyo, or maybe you can, actually organic, pa ikaw nagtanim, that's already considered organic kasi wala ka namang ilalagay na fertilizers and all. So, as yung mga future dietitians natin, no, you should also be familiar talaga what are our native vegetables, native fruits, no. Sadly kasi we encounter, no, hindi alam ng bata what is sitaw and Baguio beans, no. We have this class before na sinigang, and then what they had is Baguio beans. Sabi ko, para saan yan? Is sinigang daw because ano, parang it's beans, parang ganon. Yeah, right. So, and lately lang, no, they don't know kaimito and local fruits and vegetables natin. They don't know the difference between tofu and tokwa. Diba? So, I guess, if we really want to promote na nutrition is not really expensive, it's not, no? Talagang food choices lang yan. Kailangan tayo, equip din tayo. We know what are the substitutes, no? For, wag laging broccoli, wag laging salmon, and lagi nakita, salmon. Kasi lagi makita namin sa mga diet plan ng mga estudyante like that, it's always salmon, no? So, hindi naman, marami tayong healthy alternatives for this food.
Can we get the perspective of our student representative, please?
Hello. And related to what they were mentioning about public health, we were exposed to a lot of communities in the public health. We were deployed in Padre Garcia, Batangas for 1 month and experienced how nutrition is really important and how it really lacks in certain barangays. We saw how vitamin A supplementation is not being reached by far-flung areas, even if it's a law already and all communities or barangays should be required to have it. But we saw firsthand that they didn't have vitamin A supplementation and its effect towards their children, especially if you're pregnant or lactating. And we also saw the issue on vegetables. So yes, a lot of the communities that we were interviewing or assessing, they would say that gulay parang pang mahirap lang yan. For them, in that community or in public health, they would say mahirap lang yan, ang mahal is yung mga meat, yung mga protein. So when they say that gulay lang po yung kinain ko today, they'd say na parang hindi complete.
It's not enough.
It's not enough, yes. So in that sense, in the barangays or in public health, they'd see that as something not complete in their meals. But in a way, as students, this is our way to tell them it's actually good in terms of what we were saying about planetary health diets and such. The incomplete meals, gulay or vegetables is important, yes, but it's just in the matter of adding more to it. So adding more fat, healthier fats, fruits. If it's more on the budget naman, that's what they would mostly say na wala po kami budget for that. So the video by TGP a while ago when they would say that maintenance or health would be the one that they'll sacrifice.
Forgo, yes.
Yes, that's actually true. We also saw that, and we'd see that they prioritize rent, they prioritize tuition for their children.
Mm-hmm.
So it's nakakapanghinayang to see, but it's one of our ways as students to change that as future dietitians, as future professionals as well.
Yes, because I think also, if I may add, and to our speakers, please correct me if I'm wrong, the mentality of ay mahal, it's expensive. As Juana said, yes, it's expensive. But think about this, what's expensive? Your food now that can provide all sorts of vitamins, nutritions, natural health supplements without even buying the vitamins themselves. But I do love my supplements, TGP, I love them. Think about that, when you change your nutrition, technically you're preventing a bigger disease that will cost more. time-wise, money-wise, health-wise. So I think that's another mentality that can be tackled. See the big picture. We tend to spend money on different things, and that's really your business where you want to spend your money and your time on. Pero kung pag-iisipan nyo, if you fix your nutrition and if you fix your food, that will help so much more later. Then maybe you can prevent all these other like malnutrition, deficiencies that will end up costing you more in the long run. Diba? Plus, if you follow Juana, her menus and her dishes, masaya din. It can be something creative also. Food can be art. Another thing I think that's interesting to look into. I'll turn it back over to Philip.
When we tie it in with what was being spoken this morning, in terms of like we had Medical City, we had Ayala Health, we had also Watson's talking. There was basically that whole position that you had to really be pushing more the preventive as opposed to the curative and the palliative. But there was also that notion that there has to be an overhaul of the mindset in terms of universal health care completely, because people still don't even appreciate what universal health care can be about, what it can mean, and how it has to be processed and implemented here in the Philippines. No? So like you guys, from your positions, I'd like to ask each of you, what did you feel? Because I was putting out the example earlier this morning that in Thailand, where there's been universal health since 2002, out-of-pocket expenses for an average size only 9%. Whereas in 2023, here in the Philippines, even with universal health since 2019, it's still 44%, 44.4%. So there's such a big disparity in terms of what universal health means in Thailand or in South Korea as opposed to universal health here. And here it's been a law already since 2019. So, I mean, from your position, from your own particular companies, how do you feel you can fast track that process? Be a contributory to universal healthcare being a reality here in the Philippines?
Probably I'll go ahead. So because UHC is something that's very close to the heart of TGP, because we've been talking to PhilHealth, to DOH, since probably 2-3 years ago, when we've heard that UHC is going to be rolled out already. We've been intending to join their sandbox areas. And honestly, yes, there's been some delay to it, but perhaps what we see is that the delay is because a lot of people are not encouraged to sign up. Remember, for you to be able to maximize the benefits of UHC, you have to sign up for a consulta provider. It's a whole gamut of different, sanga-sanga siyang mga kailangan yung gawin. Pero yun yung una doon, to sign up to your nearest consulta providers. And we've been talking to a lot of LGUs, and really, their ask is, tulungan nyo naman kami. Tulungan nyo kami to encourage people to sign up. Because if we don't get this like minimum level of sign-ups, we won't be able to roll out UHC in our city, in our municipality, and that's what we've been doing. We've been working very hard with different LGUs to let them know, UHC is here, you simply have to sign up, then the next would follow.
What do you feel is the resistance to the signing up?
Just awareness, honestly. Just awareness. What is UHC? Ano makukuha namin dyan? Will we really get something from it? And because the government and the LGUs with their private partners have really been doing their part to encourage a lot of people to sign up, but the penetration rate is still very low. Kaya kahit yung mga nagsimulang sandbox areas before for Consulta and Consulta Plus or Gamot, mababa rin. Hindi pa rin nila mag-penetrate for it to be higher.
I'll be very transparent because they're not here anyway. But the news that comes out about how PhilHealth might be abused or the funds are being, misguidedly placed in other. Does that affect, for example, the
now that
public
you've mentioned it,
perception
Philip,
of
I was very hesitant to mention the mistrust in the government sector. But since you've mentioned it, I also believe that.
You don't have to agree with me. Huh?
No, but I also believe that there is that misconception. Like, yun nga nakikita nila sa balita nagagamit sa hindi tamang paraan yung pera nila, yung pera ng taong bayan. And what they say is, so if we sign up, di naman napupunta yan sa akin, kinuha nyo lang yan. Kasi if the LGU gets a sign up, they already get their budget for the UHC rollout. So probably some people would say, I won't give my LGU that chance to misuse the funds of the public. Kaya hindi na lang ako magsa-sign up. And sadly, that's the reality. It's a whole principle. It should be whole of society work, right? Letting the public sector and the private sector work together kasi napakaganda po ng adhikain ng UHC. Unfortunately, because we have, a lot of mistrust in public fund use na kailangan pa siyang solusyonan, people should trust where their funds are used. Because honestly, what the PhilHealth will use is the money of the taxpayer. Pera po natin yan. Pera yan ng taong bayan. So, yes.
How about from an HMO position? Do you trust? No?
Actually, not to preempt the works that we're doing. No, we're actually in active discussions. Being the market leader in the industry, we're working heavily or closely with PhilHealth in terms of the implementation of Republic Act 1122-3, no, the UHC. We already identified some sandbox projects. Next week, actually, we have meetings with the Department of Health as well in terms of the implementation of some of the guidelines regarding this one. Yeah, exciting things are going to happen in terms of the implementation. I think in terms of the strategy, they're partnering with trusted brands like us in terms of HMO, TGP, of course, in order to encourage more people into signing up for the implementation of UHC. And they would want to capitalize on some of the investments. Like for us, they're looking at our digital platforms because it will also ease the friction in terms of the entire member's journey. So those are exciting things that's going to happen related to UHC.
Sorry, just to add, I'd just like to add, and perhaps what the private sector could do here is, nakakapagod siya para sa kung ang normal na mamamayan nga, napapagod na siya sa pakikinig sa balita. But in TGP or in the drugstore segment of Robinson's Retail, what we'd like to believe is we still have to do our part regardless of what's happening. We cannot say, give up na kami, okay, we won't help you government with UHC. We cannot do that because we are part of the solution. And that's also my call to our frontliners here, to our soon-to-be doctors, nurses, pharmacists. Huwag tayong mawawalan ng pag-asa no matter how devastating the news are. Let's always just cling to that hope. Because if you will give up, as I mentioned earlier, it just starts with one person or one bright idea. And then just continually do what you want to do, looking for the right partners to do it, and hopefully, it will all turn out well.
Thank you very much, Carol.
Yeah. You were saying also on the part of Maxicare, you were looking for certain types of graduating students.
We're actively looking into medical technicians.
Listen, guys, listen.
We are looking for partners who will strengthen our pipeline in terms of rad tech, those who will be reading x-rays, ultrasound. We're also keen to hiring more doctors, especially general practitioners, because we will be putting up 100 clinics altogether until 2028 and more.
And will it be an advantage to have a UST diploma?
That one you have to answer.
Of course.
It's a requirement.
Iba yung sagot mo kapag nasa UP ka.
Kasi taga dun po ako eh.
Thank you very much to our panelists. Now, we have some questions from our audience that were pre-submitted, and I'd like to ask everyone, we can go down the line and you can answer. In your opinion, what is one bold change that the Philippines needs to make today to secure a healthier future in 20 or even 10 years? Let's start with you, please, Doctora.
Okay, forget the hate.
Dr. Sarmago, yes.
I believe the government should focus more on nutrition. Talagang nutrition, right? Kasi nga, the best mentioned kanina, stunting could be prevented if at pregnancy pa lang, no, we already have given the mother proper
Supplements.
nutrition. And that kasi tuloy-tuloy yung problem natin, right? If batang pregnant woman was not able to have proper nutrition, she may have low birth weight baby. That low birth weight baby may have this kind of condition when he grows up. So again, that's a cycle. So I believe if really we want to make a big change, no, it should be, we should focus more on, the government should focus more on nutrition.
Thank you very much. Juana?
I obviously agree with Doctor. I was thinking when you were talking earlier about the universal health, I don't know, and I haven't read it, but is there even like a health and nutrition component in it? But how much is it like implemented, diba? If people like us, you guys, we need to, it's really like synergy working together, because when you improve the nutrition, you lower the, what do you call it when you put the insurance base? Utilization. That's why Maxicare used to get me to talk para mababa yung utilization ng mga patients nila. It all works together, but it starts at home, it starts in your kitchen, it starts with what you're buying. It helps.
It starts in the womb.
In the womb.
As Dr. said.
I was telling Philip earlier when you were showing your slides, I said, grabe dito. In the UK and the US, they're talking about, yan na, planetary, vegetarian, vegan. Here, I'm like, my gosh, may gutom pa ba? May stunted pa? So parang the focus of people, their consciousness is not on the planet and blue water and carbon footprint. They're not even thinking of that. They're just thinking of how not to die and how to feed their kids, which is crazy given where we are at this point in time. Dapat naka-move on na tayo from that.
Thank you. Matea, yeah?
For us as students, I believe, yes, it starts at home. And even generally not even thinking about nutrition, it's your habits and lifestyle at home. Even when we eat 3 times, 4, 5 times a day. It comes from that and being aware of what we actually eat. Even as parents, even if they don't have the education of knowing nutrition or health, I think it would be still a good way to know through social media, through...
Take it upon yourself.
Yes,
right?
taking it upon yourself, and it starts with yourself before you see the effect and change with other people. Since, again, in my family, as a nutritionist, I do the groceries already for my family. It becomes a big change from our house palang that you start with healthier options for ingredients or food items. And I think it would go a long way for all families to do that as well, to start at their home or to start educating themselves first before educating others.
Sana na hindi
But since you do
naiinis sa'yo.
but since you do the grocery and you're a nutritionist, do the rest of the family appreciate you or not?
Oh my God, I was just about to
try
ask the same thing. Sana hindi sila naiinis.
Saan yung chicharon?
They try to, but it's for their benefit and for their health. And
So they hate you, okay.
yes, it's tough love. It's for themselves also.
Stay strong.
Tough love to them.
Miss Carol?
Yes, sige, ako, I'll try to be a little bit bold in my answer. I mentioned earlier the mistrust in government. So for me, I think the boldest decision that the Philippines or the Filipinos can do right now is to elect the right public officials who will champion nutrition, healthcare, right? Iboto niyo po ako sa darating na
Forget the
election.
Hague.
I'm not running.
Forget the Hague, right?
Yes, all of the politics na mauubusan tayo ng oras to focus on the real problems that our country needs. So, yes, for me, that's it.
Thank you very much.
I've been hearing a lot of the word focus, no, and I would like to align it with our strategic trust. For us, the healthcare system should focus on 5 things. Focus. Letter F is fast and agile. Product and service development. We need to develop more inclusive products because to date we can only touch the surface of those who needed healthcare the most. In terms of operational excellence, we need to be continuously looking for ways and inefficiencies within the healthcare system that we can support as a group, as a collaborative effort. No, C is more on customer-centric growth. We need to put our patients at the center of all of the initiatives that we're doing. At the end of the day, if we want to build a sustainable Philippines, we need to ensure that all of the people are present, meaning they are healthy at the start of every day, that they can deliver in whatever it is that is expected of them. We also need to utilize the power of data and digital technology because we can reap more benefits in terms of leveraging in terms of these advances. And lastly, strengthening collaboration. As practitioners in the healthcare industry right now, we need to work hand in hand in order to help every Filipino family, one life, one family at a time. Yep.
Okay. And last but not least,
So since
Chair
I'm
Kathleen.
in the academe, so I'll go back again to education. We actually have so many laws related to nutrition. 1,000 days is one. 1,000 days the baby is one of those laws. But if it's implemented properly, if we are just aware, as simple as before you go to a specialty hospital, you have to actually go first to your own rural health centers. Philippines are not even aware about that, right? So if we really educate our people as early as basic education about the importance of health in general and nutrition, I don't think they will not be mindful of their health eventually. Because as we all know, no, one individual can have one healthy individual can have one healthy family eventually, and can be part of a healthy citizens and eventually healthy workforce. So if we could only realize the value of that, so we will be able to prevent all those 7 out of 10 top mortality cases are NCDs. So that could have been prevented if we only know the value of health.
and of course, you're teaching the students that here
course.
in UST, right? We have another question that was handed in by our audience, and we'll go down the line again. If there's one habit or mindset that you could change, and that you wish every Filipino would adapt to build a healthier future, just one habit, kahit one word from each of you, what would that be? Dr. I started with you earlier, so I'll ask Professor Kath naman to start.
Siguro the habit of laziness. Okay? Because if we think na I'll do it tomorrow, I'll do it the next day, I won't do it
Guilty.
today. Okay? So looking at our plate, as simple as that, no, we have Pinggang Pinoy, di ba? For sure, all the students who are taking public health, you have that course, you've discussed it somehow. So the more colorful our plate is, di ba? The more nutrients we are getting to, we are consuming rather. So kaya lang, tinatamad tayong bumili ng healthy food, so we end up buying processed food, or we go to our phones and look for the apps who can deliver those foods. So I think that's the first one that we have to avoid.
Laziness.
And we have to work on laziness.
Okay. Curly.
Siguro for me, the habit of thinking at preventive healthcare, that's something that is optional because it's very critical for
yeah.
us, and it's really necessary to think of it ahead of time. Yep.
Carol?
For me, and I'd say this, I'm sure kilala nyo to, yung okay na to, okay na yan, mentality
Pwede na.
Pwede na yan. And probably in terms of, drinking your maintenance medicines also, or your supplements, your vitamins, okay na yan, hindi ko inumin ngayon, bawi na lang ako bukas. And we all know that that's not the case.
Guilty!
Super tatamaan ka. Yes, yung mga ganyan, yes.
I think for me is the habit of overeating or undereating. I think as nutritionists, we find it a problem for patients or people in general to think of nutrition as, ay, kailangan ko mag-diet. So they don't enjoy food. That's one of the big problems as well as future dietitians. So I think
Because it can be really fun, right?
Food is fun.
It is fun. It's really
Yes.
fun, yeah.
But as nutritionists, yes, we need to have movaba, which is moderation, variety, and balance. So you just have to eat in moderation and variety, and to balance what you eat and what kinds of food you eat.
Do you feel targeted, guys? Parang you're talking about all of us.
I think
Juana?
mine is the same as them, yung okay lang. Because parang okay lang, cheat day, naging 2 cheat days, naging
Cheat week.
Babawi ka na lang later. And there's no going back. You cannot make bawi certain things.
Doctora?
Hindi ko, sorry, just call me Maui. But for me, I don't know how to say it, pero yung nagmamadali with the results, no? Parang, di ba, when we teach patient, pag hindi when they see na hindi naman nagbago, or like for weight loss, for example, they expect na big results agad. No? We're very, parang impatient tayo na mangyari. So, yun, yung mga, you should always parang, you should think of it na parang small wins matter, no? Na hindi agad nangyayari. Like of course, when we change our diet, the results will not be that abrupt, no? So, yun lang sa akin, parang dapat we also learn how to wait, no, for the results to happen. And ganun din tuturo natin sa mga pasyente natin, di ba, na let's also manage their expectation when it comes to our management.
I can see a lot of nodding in this. It's okay, don't be shy.
They're my students, that's why.
Kaya pala. Well, that's perfect.
Sip-sip, mga sip-sip.
That's perfect because now we are going to open the floor to our guests in the audience. If you have any questions, clarifications, violent reactions to any of our panelists and speakers, please just come. There's a microphone here in the center, here in between your rows and columns. Please come forward and ask your questions. Ayan na, meron na. Don't be shy. Please come on over.
For extra credit with your
Extra
professor.
credit daw. Oh wait, we have a question already over here. Go ahead, please.
Good afternoon.
And let us know who your question is for, or if it's for everyone.
So I am Tina Cordar. I'm from nursing and for level 4. So this question is directed to anyone under the nutrition or those who are particularly concerned in sustainability in general, because I think this is multidisciplinary. So one of the speakers mentioned earlier the Eat Lancet Planetary Diet. I think this is novel. I think that's very interesting at how it could be implemented here. And you said it's already happening right now. There's already work in progress. So I would like to gauge the feasibility of that diet into our hospital meals, because it was mentioned earlier that hospital meals are so stale and it's so uninteresting. So perhaps this planetary diet could find its way into our hospitals. So I would like to ask if this is possible, what are the challenges, and what could be done in order to make this
It is
happen.
absolutely possible. Years ago, Medical City is not here, but we did do it. In fact, at that time, it was Medical City, VRP Medical Center, Manila Medical Center, who Maxicare sponsored. They did it for the Maxicare patients. If you're a Maxicare patient, you got a menu, and it was our plant-based meals, which were mine. And we trained the hospital staff. That was even stricter, because that was like 0 animal. Now with the advent of the planetary diet, which came out in 2019, when I adjusted it to Philippine consumption, it's now maybe 10 to 12%. And Doctora was saying earlier, diba 17% yung content of the plate for protein. So it's well within the ranges. Now the planetary diet has been adapted in France, the US, Denmark, so many places. And they always adjust it to the actual consumption and preferences of the people, because you can't force them naman to just always eat the vegetables. So let's say in Denmark, there's more cheese because there's so much cheese. There's herring, there's salmon, there's stuff like that. Here, I'm adjusting it to include some pork because we love our pork. And we don't want an unhappy population. So I think a collab with the hospital is possible. We've done it before.
Okay, I agree with that. No, in addition na lang, siguro, they should understand that when say planetary diet, it's not really vegetarian. Kasi yun yung naisip nila na totally wala ka ng meat products. But no, again, sabi nga, it's only 17%. And really, in the hospital, we do patient's visitation and interview to get the patient's food preferences, no? To make sure, again, that what the diet we prepare will be eaten, for example. Ganon, no? So, Yeah, we can collab, no? And also, no, kasi we have here CTHM students, no? Okay, kasi kailangan din ng help nila, di ba? The future chef, I mean, they're really good, no?
Culinary
And coming,
students,
yes,
yeah.
creative menu, we can also tap these people, no? Na kailangan collaboration talaga, you know?
Maxicare will sponsor it again,
Oo,
diba?
correct.
Actually, we're looking for to partnering in 2 schools. We'll be launching a project wherein we will be supporting thesis studies that will be able to contribute to preventive healthcare like nutrition, other things. I allocated a portion of my budget to do that
So
program.
thanks to your question.
That's well done.
Thanks to your question. If by later this year there's a collaboration between Maxicare, UST Hospital, and Mesa and Misis, then you're responsible for that.
What's your name again?
Maria Cristina Cordero po.
Okay.
Remember that.
They will
Marites.
either
Yeah,
remember you
Cordero.
or curse you.
Thank you po for answering.
Next question, please.
Hi, good afternoon po. I am Therese Lasaleta, a first-year student from PT. But first, I'd like to thank everyone for taking their time to be with us today and enlightening us students with your insights regarding the future of healthcare. So, yung question ko, medyo controversial siya.
Gusto namin yun. It's okay, go
So
ahead.
it's regarding AI kasi. So this is for everyone to answer. What are the biggest challenges you foresee in integrating AI and digital platforms into mainstream Philippine healthcare?
I think Maxicare would have.
I'll answer first, okay? Since I'm into nutrition education, actually there are so many benefits of AI to healthcare. I'll be more specific to nutrition education. So you can come up with very good tools, actually. The content will definitely be yours, but then the layout, how you want it to be more pleasing to the eye of your target audience. So you can maximize that for your nutrition education courses or even to other health education courses. We're actually inviting you on Friday. We have, may sa segue, no? We have a nutrition education culminating activity wherein we'll be presenting, ano yung mga estudyante ko dyan, kinakabahan, mataas yung expectation, that we're exhibiting actually different nutrition education materials. We actually did needs assessment with our partner communities, and some of those materials actually were we use not just apps but some online website platforms, that can be used on social media and other online platforms. So I think it's very helpful. But the big but is you have to also check, because AI apps now are very humanized as well. So as if you're talking to a dietitian, no? In Australia nga parang meron silang when we had a benchmarking there, parang the dietitians are not inside the dietary. They're actually in the office, and there's this app na you can do counseling with your patient. So that's helpful kasi special to those immunocompromised patients. You don't get to really enter the room, no? So that part, the patient is more protected, but at the same time you can give nutrition education. But let's not forget that there's one thing that AI cannot do, and that's us being humans, giving compassionate, as the Mashans, diba? Compassionate way of counseling. Diba? Sometimes kasi patients are too bored seeing all the parang room lang all throughout the day. They're just inside their room. So that's one thing that AI cannot do. And plus, when you use AI, make sure you're the one who provides the content. It's not the AI. It will just simply make your life easier. But it should not change the way you think, because in real life, pag andyan na yung pasyente mo, baka mamatay kasi kailangan pa ng app para lang mag-deal with the patient's concern.
Thank you. And, sorry. Okay. As mentioned earlier in my discussion, diba, we said that, of course, AI is inevitable. It's there. Tech is there, and it will continue to be stronger in the next couple of years. But it cannot, no app or no tech or no AI can replace compassion, trust, and community engagement. And also, in terms sa community pharmacy, where TGP is, Of course, there are still areas where internet is not there. Of course, walang phone si nanay, walang Wi-Fi. So these people who really needs to be served will still greatly rely on you, on the people providing their health care. And that's why we strongly encourage you, do not be disheartened by, papalitan naman ni AI yung trabaho ko. Because no, there are still a lot of islands, there are still a lot of barangays in the Philippines na nangangailangan sila ng kausap nila. Sino ba yung magpro-provide sa akin ng tamang medication, tamang advice, paano inumin ang gamot? Ano bang kakailanganin ko kapag sumakit ang ulo ko? A lot of people in these far-flung areas, ang uno nilang pinupuntahan kapag may masama silang nararamdaman is the pharmacy. They talk to their pharmacist. Masakit po ang tiyan ko, ano pong iinumin ko? Masakit po ang ulo ko, 3 araw na po ito, ano pong iinumin ko? Kasi kapag pumunta sila sa isang pharmacy at tao yung kausap nila, yung pharmacist ang kausap nila, hindi naman sila i-charge ng consultation fee, right? At nabibigayan sila ng agarang solusyon sa nararamdaman nila. So, compassion, trust, and the community engagement, tayo lang ang makakagawa nun.
Yeah. So, hello, yes? Does that answer your question?
Yes, po. Thank you.
Thank you. I think there's also a nice way you can have AI complement your nutrition, like who's guilty, ChatGPT. You can say stuff like, make me a menu with, then you put in your information, like I need 100 grams of protein, 20 grams of carbs, and then you can input all the nutrients that you need. So there are ways to work with it, right? But yeah, you can combine it with your current knowledge. Okay, yes, we have a question here. Oh, I'm sorry. Yes, miss? Go ahead, yes, please.
Good afternoon. I'm Patricia Nicole Ortiz, and my course is Bachelor of Science in Food Technology. So this question is addressed to the nutritionists, the professionals. What are your thoughts on using agriculture byproducts for food fortification to address food sustainability? For instance, the uses of banana peels in burger patties to enhance dietary fiber.
Okay, I'll answer first because I have a research currently with Food Tech Department with Ma'am Essence. So we actually have a collaborative research funded by the UST. So we're using complementary protein, using oyster mushroom. Kamunti ko pa makalimutan yung research ko. Okay, so basically, one good thing about food technology is that it will improve the product. So like for instance, if you want to increase the fiber content of the food item, you get to test it. But at the same time, it should be something that is not just high in a particular nutrient like fiber for your study right now, but also it should be acceptable in the market. Because we had several products na even our students did, na parang it's high in protein, it's high in fiber, but when you go to the community, they don't like to eat it. And I think it was mentioned by Ma'am Maui earlier that if it's not consumed, it is not nutritious, no? Kasi nga hindi naman kinain ng pasyente. Ako, when I am asked yung what are the qualities of a good food, I always snips, no? It should be satisfying, di ba? It should be safe, number one. It should be safe, it should be nutritious, it should be economical or affordable, it should be acceptable, okay? And then it is aesthetically pleasing. P is for palatable, dapat masarap. And it is S for satisfying. So if you're doing that, yes, we can improve the nutritional value, but at the same time, make sure it is something that is preferred to be consumed. Kasi
acceptable to the one who's eating it.
Because sometimes the students are being theoretical in a sense that there is this in the hedonic scale na this is the point that most of the, marami nag-research kasi into sensory evaluation right now. So if you get this score, it is already acceptable. That means pwede na, okay na to. But then when you bring it to the market, you will be surprised why it's not being consumed. It's acceptable. Yes, it is acceptable in the sense that pwede na. But if they would like to depend on eating that particular food for the longer time, they would not like it. So the key is MOVABA, moderation, variety, and balance.
Our nutritionist, Juana, yes?
I think it really falls on my area of cooking, right? So in terms of food waste, there's there's ugly vegetables that people, like by the time it gets to supermarkets, pinagpilian na yan. There's so much wastage. When I do my studies in Ormoc, there's a mountain there. There's a barangay there. All they do is sell pechay and eggplant and okra. And the side of the road is just littered with pechay. And I'm like, can we stop and get this? Because in Landmark, it is 170 pesos. I come home, I smuggle like vegetables home. When I come back, and I was telling the mayor, I love like Korean stuff kasi. So I said, alam mo, pwede natin kaming kimchi, ibenta natin. Yung mga kamatis nyo, gawin yung tomato sauce, the eggplants, turn it into baba ganoush, and sell those things. There's all these things that the people in the communities, they don't know parang what they have. And I was like, my gosh, kung nakita niyo yung mga taga Manila, they'll go crazy when they see how big it is. Kimchi naman doesn't need to be perfect, diba? In fact, it just, you don't even need a fridge for it. You kind of let it ferment for days and days.
You can kind of keep it for a while. The shelf life is long.
Exactly. So there's so many things. Yun nga, kulang po sa education on what we can do with these things. Ang dami.
Calling the culinary students, please. Let's come up with nice menus.
Actually, that's what I'm going to say also. No, if really want to come up to use those ways, no, consider as ways, we should work together. No, dietitians, nutritionists, food technologists, and the HRM students here, di ba, yung mga future chefs natin, no? We can work together, no? Again, that would, create healthier food options pa for our people.
Doesn't just taste good, it looks good too.
And actually, if you have that collaboration between Maxicare, Mesa and Misis, and USTH, you can turn it into a case study.
Yeah.
See, actually over a timeline, di ba?
And
What
then,
happens in terms of the nutrition aspect of the patients, whether it helps them, whether they even found it palatable, whether they liked it. And then you can now turn it into something like a model study of what other hospitals can adapt.
Then open a restaurant. Oh, diba? It's branching out into so many things, diba? We'll come back here and we'll talk about it also.
But in the restaurant, only sick people can come in.
Or we can prevent sick people with this restaurant. We have time for our last two questions. Over here, please.
Good afternoon to the speakers and the guests. I'm Charles from Nutrition and Dietetics. As future healthcare professionals, we're often told that sustainability is everyone's responsibility, of course. But sometimes it's quite hard to visualize ourselves as students. Like how we can make a real impact, especially in big companies and institutions like yours. So I'd like to ask, what role do you think we students can play in encouraging healthcare organizations to adopt more environmentally sustainable practices?
I'll start while they're thinking. I think students definitely are the ones who you're the future people who are going to come and take over these companies, right? There's all these memes now. So we're ano ba tayo, millennial, right? So there's all these memes about millennials relating to Gen Z and all of these things. And how we are the ones who have to adjust because ang dami nyo, ang tanda na namin. So you guys, even as early, maybe we don't look old, but as early as now, if you voice out what you want to see in the company that you want to work in, they're the ones who have to change. Because if they don't change for you, nothing's going to happen to them. So students have such a strong foothold in that. Now I hear of young people turning down jobs. When I was a student your age, I would do anything I could do. But okay, I'll do that. Lahat na gagawin ko. Now you guys have the power to turn us down. And that's scary. So take that, but be responsible with it. Take that power that you have and use it well to make a difference, to help Maxicare, to help TGP, to help these guys evolve into the world that you want to see, because it's for you guys.
And for me, siguro, I'll extend her answer a bit.
you have to, as early as now, I'm sure you already have that image in your head. What do I want my society, our healthcare sector to be 10, 20 years from now? Kapag kayo na yung may pamilya, kapag kayo na yung nagtatrabaho. And cling to that image in your head. Go to your private sector, but also go to your public sector, to your officials and say, hey, kami ang mabubuhay 10, 20 years from now. Ganito namin siya gustong makita. And as also mentioned in what I discussed earlier, sustainability is, sometimes it's pretty daunting, like, oh wow, sustainability, big word, right? But you also have to remember that it's really doing the right thing every day, making that right choice, that conscious effort to do the right thing every day. And then it leads, those small steps, believe me, it leads to a big impact. So number one, clinging to that image in your head. How do I want my society, my healthcare sector to be 10, 20 years from now? And making sure that I am heard. That image is still in my head. I cling to that image. And then number two, just committing to doing the right thing every day. It's simple. It's very, very simple. It's easy to say, but it's hard to do. Right?
Ako muna, ayun. So, ako lang din, no, try to work in a healthcare institution, hospitals. And then, alam nyo, yung passion nyo for preventive health, mag-ano yan, mag-spark yan. Kasi you will see, no, the burden of being sick, no? You can see, hindi lang yung may sakit na pasyente, but the effect on the family, no? Financially, emotionally. And dun yung spark mo na, I really want to promote preventive nutrition or preventive health. Kasi para hindi na to may mabawasan yung mga family na may mga ganitong problema. So, again, I encourage all of you here na nandito, no? The nurses, the nursing students, PT, nutrition students, and or pharmacists or medtech, work in a healthcare institution, work in a hospital. Doon pa lang, no, para dumami tayo na advocates of preventive health. Okay.
Ako naman, from clinician to public health specialist. So try to work in the community, no? The chance is now. You have your on-the-job training. Yan, sabi nga ni Mama, you try to observe. For sure, you've learned a lot from, yung mga nag-OJT na, you've learned a lot from your community. And those who will be having their OJT still, no, when you're there in the community, you will realize it's not just as important as magturo ka ng you have to store this food safety and all, but try to understand, why can't they do that? Okay? How come it's difficult for them to do these things? Kasi there's always an underlying factor. There's always a reason why. No? Parang andali lang kasi mag-prepare ng food and all. But there's a reason. Okay? So, try to savor that moment in the community and maximize your learning when you're there. And as a favor to ask from you, try to work here in the country for a while. I understand. Most of our students then will proceed to medicine or will go abroad. Try to work for a while. Siguro yung lagi ko sasabi sa student pag public health, para at least you get to also help. Kasi hindi lang yun yung online tayo na nakikipaglaban, di ba? This is your way. You don't have to be Miss Universe to have an advocacy, di ba? This is your way to do something for the country.
Or if you're not going to work here, make sure you come back. Because that's the other thing, but there's a lot of gain also. I'm not going to discourage anybody from working abroad because I know there's the reality of the economics of it. And so you're getting yourself educated, you're spending your parents' money or whatever to earn, and I'm sure you're trying to get a career for yourself afterwards. If that career happens to you abroad, why not? But just remember to come back.
Come back here because you'll always be somebody in your own country and you're just another person in another country. You're just another person on a visa there. Here, you're someone.
And you can be a consultant or professor here in UST and help the future students who are coming after you.
And one day be invited by us to speak in this focus session.
Yeah. Okay, thank you very much. And we have time for one last question, please.
Good afternoon po. I'm Chloe from the Nutrition Dietetics program din po, second year. Just to give a background din po, parang habang tumatagal din po kasi yung my initial reason kung bakit gusto ko pong mag-ND is for medical doctor po. But habang tumatagal ko po, parang mas nako-convince na po akong mag-community. And doon ko po mas nakikita sarili kong mag-work po doon. And na-mention din po nung one of the speakers is our role as health advocates po is to walk the talk po talaga. So, I personally struggle din po kasi yung pag-utilize ng mga native ingredients po since ayoko po ng talong, ayoko po ng okra, which is ironic nga po kasi you should promote these native ingredients po kasi paano ka pong makakapag-convince ng mga clients mo or patients, especially po yung community, which I can see na medyo difficult din po i-convince. So, my question po actually is for Miss Yupangco po, tama po ba? I tried researching po kasi yung Mesa ni Misis after your talk po. And then, I saw na meron ka pong book. So parang na-excite po ako na, ay, madami pang pwede akong matutunan ng mga ingredients and recipes na pwede pong ma-utilize po yung native ingredients. And para din po discipline ako po sarili ko na magamit po yung kumain po ng talong, kumain po ng okra. So, is it still available po ba?
Yun yung question mo?
Give it
Yun yung question pala. Yes, it's available on Shopee, Lazada, and fully booked. Yun lang yung tanong mo sa akin. Dami kong alam.
She was nervous.
Dami ko talaga ko sa gulay.
She started with ayoko ng talong.
Wala akong magagawa dyan. But I think I know where you're coming from. So many people don't like talong, don't like okra. They hate it. There's something in okra called mucilage. That's the slimy stuff that you probably hate. But that's the same stuff that makes you go to the bathroom. It prevents diabetes. Those are the things that you think of. There's a way of cooking things. And I think Pinoys, nasanay tayo sa nilaga, ginisa. You look at the cuisine of India, Morocco, Africa. They use so many spices, diba? Yun yung sinasabi ko when I go to the communities. And the truth is, when you do go to those communities, they act like ayaw nila, but alam nila yan. They know deep in their hearts that it's good for you. You just need to teach them how to cook it, how to make it taste different than in the carinderias like that. The vegetables are gray. They're not even green. Walang kulay, patay na siya. You just need to teach them different ways of cooking. I advocate for not using cooking oil. Instead, nagigisa ako with water. Onions naturally have oil in it. So you put that first in a hot pan, a little bit of water, then everything just glides. So that's something that you could take up in the community. Team up with the culinary students, learn new ways, eat out, try different foods is my advice for you. There's ways to cook okra that's not slimy. So yun po, that's why, as Aziza said, it's exciting food.
And the real answer was it's available on Shopee and Lazada.
That's the real answer,
The
Shopee
Mesa
and
and
Lazada.
Mrs. Cookbook.
Is it okay if I can add?
Juana, you can send her a signed copy maybe and encourage her.
I've actually tried one of the recipes in case
Did you
because
eat
she's
it?
used mongo for
okay.
the bolognese.
Did you throw it away? No.
No. I fed it to my dog, but no, actually, and he died. But
Philip's lying.
yeah.
He's one of my biggest advocates for my 2 cookbooks.
But it's using mongo instead of beef for the spaghetti bolognese, and it actually works.
Yeah, actually, he said.
Oh yes, I'll add something. Other than the book of Mesa ni Misis, we were able to get a book from FNRI. For those nutrition students, we were able to get, it's just a free book from FNRI. It's healthy recipes with ingredients, different kinds of recipes. I think there is ampalaya pancakes there. There's a wide variety that we're partnered with food technologists. And we were able to give that to our barangay in our practicum as well. So you can explore that as well. And adding to what Ms. Juana said, it's really just exploring. We also did that in our thesis. We went to Oriental Mindoro for our thesis, and we had to figure out what kinds of fishes that they have to eat there in Oriental. There's so many. So it's different in each place. So you have to really explore ano yung kinakain nila doon in order to know ano yung ibibigay mo sa kanila as a future dietitian.
Like I said earlier, one thing that we do as a team, we go to as soon as we land in a place, sa palengke muna kami. We check everything there to see what's available, because before we can recommend, we have to know if it's available in Ormoc, which is my latest city. They only have mongo and they only have tokwa. There's not much chicken actually. So parang we had to recalibrate everything. Use all your senses as a dietitian. It's common sense.
Yeah.
That's the most important sense. Look around and see what's there.
So what you can use, what's available. You don't have to parang give yourself a hard time na, ay, wala naman to. Sige, wag na lang.
And they're you're saying make it palatable. Do they like spicy things? Do they like sweet things? If you're talking to someone from Bicol, they'll put chili in everything. In the Visayas, they add sugar to everything. But, just work with what they have. Because you need to make your patients own the food that they're cooking. Just because I'm teaching it to them, you ask them, it's a dialogue. Ano ba yung gusto nyo? Sa inyo, paano ba yung spaghetti? Paano yung lasagna mo, mami? Baka pwede mo ko turuan. You need to listen to them also para may investment sila in what they're eating.
And like our panelists said earlier, the students are the future, and there are so many of you here, and you might think your courses are unrelated, but actually you can work with each other. I know we're talking about sustainability, we're talking about nutrition, we're talking about health, and I am low-key advocating for the HRM students because I am a graduate of HRM. There are so many things that you can do for when you graduate and move on for the future establishments, food establishments, dining establishments, or even food supply like groceries. Use what you learned today and what you can learn from each other so you can collaborate and really come up with a solution that covers all these aspects. Because you don't want health to be, oh God, it's boring, it's bland. It can actually be really fun and delicious also. So that's another thing to consider.
Yun lang po. Thank you po.
Mag-order ka na. She'll send you the link, okay?
Lazada, Shopee.
Oo. She'll sign it for you. So, unfortunately, that is the last of the questions that we can answer. To our panelists, thank you very much for joining us this afternoon. And to all of you also who asked your questions and sat with us since this morning. So for now, may we ask our guests, can we please take a group photo? And to join them, I'd like to call on our Manila Bulletin executives. Please join the photo, Mr. Jordan Tan, Miss Irish Lorenzo, and Mr. Ray Ilagan. If you could. Yeah. So for that, I'll just ask Matea and Professor Catherine to stay here on the side first. We'll just take a group photo with the Manila Bulletin executives, and then please stand by, don't leave, because you will join the second set of photos, okay? And we'll also... We'd also like to ask Father Coronel to stand by because we'll ask you to join the second set of photos. Okay, good? Yes, please, Professor Kath and Matea. Father, would you mind joining us for the group photo, please? We'd also like to ask the Director of the UST Office of Public Affairs, Micaela Lagiton, to please join this photo.
And Leslie Araujo, Head of Marketing for Manila Bulletin, if you could join us.
Leslie Araujo, yes. Hello, thank you. Okay, so everyone, just please face our cameras and our students, whoever's taking a photo, and smile. All right, thank you very much. Let's give another round of applause to our very educational panelists. Thank you very much for all of your insights today. Thank you, Juana, Mesa and Misis, our keynote speaker, for sharing your insights. And thank you very much. And with that, to close our panel today, may we invite back Reverend Father Louis Coronel, the Secretary General of the University of Santo Tomas, for his closing remarks.
To our friends in the Manila Bulletin executives, composed of Mr. Philip Ku Unjeng, MB Sustainability Focus Session Project Lead, Mr. Jordan Tan, Business Development Manager, Ms. Irish Lorenzo, Branded Content Group Head, Ms. Leslie Araujo, Brand and Marketing Head, Mr. Ray Ilagan, Editor for Environment and Sustainability, distinguished speakers, valued guests, partners from the government, private sector, the academe, and fellow advocates. Good afternoon and peace in the risen Christ. On behalf of the University of Santo Tomas, I wish to express our deepest gratitude for your meaningful presence in this second edition of the Sustainability Focus Session. Together with the Manila Bulletin, we are truly honored to have hosted this important gathering where insights and advocacies converge around the themes of universal health care, proper nutrition, and sustainability, all of which are urgent concerns of both policy and conscience. Today's session allowed us to listen to voices from various sectors, from the health sector to community-based initiatives, from academic leaders to healthcare providers, who each bear witness to the challenges and hopes of building a healthier, more sustainable future for the country. The late Pope Francis writes in Laudato Si, health is not a consumer good, but a universal right, and therefore, access to health services cannot be a privilege. These words challenges us to examine how our structures, economic, ecological, and social, either promote life or erode it. Sustainability, then, is not merely a matter of science or policy, but a moral imperative. When we nourish bodies, when we heal the sick, when we protect the vulnerable, we fulfill our vocation as stewards of creation and defenders of human dignity. Here in UST, we just celebrated 414 years, the oldest Catholic university in Asia. We remain steadfast in our mission to form servant leaders who embody these gospel values in real and transformative ways. This mission is alive in our research, in our partnerships, and in the voices of our students and academic staff who continue to raise the bar for socially engaged education. Let this gathering not end as merely a session, but a seed of collaboration, a seed of renewed advocacy, and a seed of hope. May it bear fruit in our institutions, in our policies, and most especially in the lives of those we are called to serve. Once again, thank you, and on behalf of the Very Reverend Father Richard G. Ang of the Order of Preachers, Rector of the University, let us go forth and continue to be builders of a just and life-giving society. Maraming salamat po and God bless.
Thank you very much, Father Louis. Okay, guys, and now for our conclusion, it's time for the raffle. So, I need all of you to pay attention kasi we have 55 winners. Okay? So, I need you guys to listen for your names, okay? You gotta listen for your names kasi hindi ko na uulitin kasi ang dami. Otherwise, 6 o'clock na tayo uuwi. Okay? So, again, some instructions. Please listen for your names. And in order to claim your prize, you need to bring a valid ID. Okay? Okay. I believe you. you, okay? And you can claim your prizes at the registration area located to your right, okay? Remember that, it's over there, to your right. Okay, are you ready? It's time to listen. Are you ready? Can I get a yes? Okay, so for the MB Sustainability Focus Session, the winners of Watson's Pink Box worth 600 pesos. Listen carefully, I'm not gonna repeat kasi ang dami. Eileen Roda A. Balane. Hala, Eileen Roda A. Balane, Christine Lorea Buku, and Michael Berinia. Oh no, what are we gonna do if they're not here? Again. Is someone here? You have a winner? Okay. Are you Michael? Are you the winner? Okay. Take note. We have one winner from that segment. Okay. Sige, we'll have to redraw. May I ask, Jaime, what is the policy kung wala dito ang winner? Wala na. Akin na lang yung GC. Okay, while waiting for that, let's move on muna to the next prize. Watson's Blue Box worth 1,000 pesos. The nutrition students are going crazy. We have two winners for this one. John Vincent Ramos. Congratulations, and forgive me if I'm pronouncing it incorrectly. Is it Zaylin or Zaylin Laka? Zaylin, wala? Are you here? Zaylin. Okay, yay, congratulations. So again, just proceed to the registration office to your right, bring a valid ID. All right, up next. Woo. Oh my God, be careful when you step here. Watson's Big Yellow Box worth 600 pesos. First is Julian Luis F. Patawaran. Congratulations, Julian. Next, Kelvin Domingo. Ay, wala. Umuwi na siya. See? That's what you get when you don't stay like the teacher says. Okay? So may I just ask, Jaime, please take note of the missing winners. Next one, Pauline Rose Limin. Pauline, are you here? Pauline. Ano, umalis na din. Oh no, what are we gonna do? We have missing winner. Okay. Philip, what are we gonna do? Okay, I'll read the next verse until we find out what we're gonna do, okay? Next one for the Watson's Big Yellow Box, Jarmaine Jamil G. Fong. Jarmaine, are you here? Okay, very good, congratulations. Next, for the Watson's Yellow Small Box worth 600 pesos, Lance Balatbat. Are you Lance? Wala rin. Ba't kayo tumatawa? Akala ko may winner na dito. Oh, sorry. Ikaw na lang. we will ask our production team, okay? What's your last name? Let's see. Okay. Next, for AC Health GCs. AC Health GCs. We have 12 winners here. Kevin Luis Lim. Wala. Okay. Please take note, Jaime, what we're gonna do. Okay. Arabella, is it Gener? Arabella Gener. Wala. Okay. Next, Daniel Angela Espinosa. Are you here? Okay, congratulations. Your prize is at the registration area. Next, Amiel Bryn Carganilla. Amiel Bryn Carganilla. Wala. Okay. Nako, Jaime, maraming wala. Let's see what to do. Let me know what we're gonna do. Next, Abigail Joy Barboza. Abigail Joy Barboza. Okay. Not here? Okay. Next, Rian Denise Bernardo. Rian, are you here? Rian Denise Bernardo? Oh my. We have a lot of missing winners here. Next, Jessica Althea Marie Gitap. Jessica, yes, yes? Jessica? Okay, congratulations! Yay! Next, Marion Ayuste. Or is it Marione? I'm sorry, Marione Ayuste. No? Okay. Next, Alyssa Padilla. Are you there, Alyssa? Wala. Ba't kayo tumatawa? Kilala niyo ba? Guys, if you know the winners, you can text them that this is what they get for not staying until the end. Okay? Next, Carol Sofia C. De Los Santos. Yes? No? Carol Sofia C. De Los Santos. She's there. Where is she? Okay, congratulations. Okay. Last two winners of the AC Health GCs. Mary Ann F. Galicia. Mary Ann, are you okay? Congratulations. And last for the AC Health GCs, Trixie Fontehon. Trixie Fontehon. Are you here? Okay, Trixie, wala? No? Okay. Okay, well, we will move on to the next prize first. AC Health Umbrellas. Hindi lang ito pang rainy season, guys. Mainit sa labas, kailangan nyo ng umbrella. Mainit sa labas, kailangan nyo ng umbrella because UV rays are bad for the skin, okay? They cause skin cancer. We have 13 winners. Queen Estelle Olegano. Trish Ann F. Celerio. Ayun yun ang payong. Trish Ann F. Celerio for the AC Health Umbrella that will protect you from the summer heat. Rafael G. Valeros IV. Yes? Oh, hello. Yes, congratulations. Yay. Don't forget your valid ID. Aliana Marie Cruz. Are you here? Okay, congratulations, Aliana. Next, Hannah Francesca Nipas. Yay! Where is she? Hannah Francesca. Okay, congratulations. Very good. Next, Nicole Diane Jangkan, yes? Nicole, yes, hello. Next, Maria Balboa. Are you here, Maria? Text niya siya. She's missing out on an umbrella. Next, I'm sorry, I am having a hard time reading this. Jem, can you help me, please? Is it Jash V Asuncion. Okay, so we have a quick update. You can claim your prizes until 5 p.m. And if you are good friends, you can text your classmates na they can claim their prizes until 5 p.m. And then we'll take it from there, okay? Jash V. Asuncion. Okay, next, Janine Danielle Batul. Janine, congratulations, AC Health Umbrella winner. Next, Kurt Russell Vincent Miranda. Kurt, wala. Okay. Text mo siya. If you like, kung kilala mo. Next, L. Arwen Baliscas. Congratulations, L. Next, last two winners of the AC Health Umbrella. Agnieszka Estialbo. Agnieszka, I hear applause, Agnieszka? Okay, Agnieszka, congratulations. And the last winner of the AC Health Umbrella is Sydney Javier. Okay, now we're going to move on to the next set of winners for the AC Health Notebook. Okay, AC Health Notebook. Everyone needs a notebook. First, Arnel Jacob Tamayo. Arnel Tamayo, are you here? Arnel Tamayo. You have until 5 o'clock to claim your prize. Next, Stephanie Veloso. Stephanie Veloso. Stephanie Veloso. Okay, next, Frank Senyo. Frank Senyo. Are you here? Okay, wala. Moving on. Regine Pama. Regine Pama, are you here? Regine. I hear applause. Hi, Regine. Congratulations. AC Health Notebook. Next, Aneka Yana Swansing. Aneka Yana Swansing. Anyone here? No. Patingin naman ang umbrella. Oh, see, very useful. Yes. They have until 5 to claim their umbrella. Okay. Next, for the AC Health Notebook, Precious Nicole Kiambao. Precious Nicole Kiambao. Okay. Next, Lindsay Joan Tamondong. Lindsay Joan Tamondong. Or Joanne, I'm sorry. Lindsay, okay, wala. Next, Amira Marie M. Fernandez. Amira, are you here, Amira? I hear applause. Amira, congratulations, winner of an AC Health Notebook. Guys, again, if you don't mind, you can text your friends. I-IG story mo sila na nanalo sila. They have until 5 p.m. to claim their prize. Next, after Amira, Mishka Ko. Mishka. Yes, Mishka, congrats. Next, Althea Javier. Althea Margarita Javier. Yes? Yes, Althea? They're pointing. Althea? Over here. Okay, perfect. Thank you. Roxanne Kunanan. Roxanne Kunanan, you are another winner of the AC Health Notebook. Next, Rafaela Deguito. Or Deguito. Are you Rafaela? Oh, yeah, there. Okay, congratulations, Rafaela. And the last winner for the AC Health Notebook is Chanela Yambao. Chanela Yambao. Chanela, are you here? Okay. If she's not here, if you could kindly text her, she has until 5. Okay, next. Masaya to. TMC grocery package. Woo! Yes! TMC grocery package. We only have 2 winners. The first one is Raymond Romeo Guzman Jr. Raymond, are you here? Raymond, congratulations. Pa-share, ha? Congratulations. Now, the last winner of our TMC grocery package is... Are you ready? Are you listening? Alyssa Marian Angbenco. Alyssa, bakit? Is she here? Alyssa Marian Angbenco. Wala? Are you here? Wala. Again daw, Jaime. What are we gonna do? No na, that's it? That's it? Okay. Tanungin niyo si Jaime, guys, kung anong pwedeng gawin. Tawagan niyo siya. Next, Maxicare Lifesaver Health Card. Only one winner for this one, guys. Bea S. Parcon. Congratulations on your Maxicare Lifesaver Health Card. Again, you can claim your prizes at the registration area to your right, and please bring a valid ID. Okay, last but not least, guys, TGP Care Package worth 700 pesos is our last prize, okay? TGP Care Package worth 700 pesos. We have 4 winners, the last 4 winners for this. First is Gabrielle Isleta. I love this segment. Ang galing. Congratulations, Gabrielle. Second, we have Alexa Trinidad. Congratulations, Alexa Trinidad, on your TGP Care Package worth 700 pesos. Last two, guys. Last two. Lance, Gabriel, is it Diong? Yeah? Yay! Yay! Nanalo si Lance! Don't forget your valid ID, Lance. Don't forget. And our final winner for the TGP Care Package worth 700 pesos is Nicole Kureg. Kureg? Sorry, Jem, is it Kureg? Nicole Kureg, are you here? Wala. Okay, so si Lance na yung last winner natin. Okay, guys. Well, thank you so much for scanning the QR code and answering that survey and for your attendance here today. And that officially concludes the second edition of the Manila Bulletin Sustainability Focus Session. So we look forward to imparting more knowledge on sustainability initiatives and efforts to our future leaders. And again, make sure you work with your fellow students, collaborate with each department, and see how all of your courses can help build a better, sustainable future for healthcare and nutrition in the Philippines. Once again, I'm Aziza Mondoñedo. Pleasure being your host this afternoon, and I'll see you at the next one. Have a great day, everybody. Thank you.